Hello, a very good morning to all of you, and welcome to the MEDENGAGE Summit. I'll request everybody to be seated as we start this summit. And may I request Dr. Nilesh Shah, sir, to please come onto the stage and start the program. Dr. Nilesh Shah. I request the participants kindly be seated. Please help yourself and be seated.
Very good morning, friends. I must tell you, it's Sunday morning, and when I entered this hall, the kind of motivation and emotions I see in this hall is something extraordinary, and which will be remembered all life. I see in this room multiple generation of doctors, people who are going to make difference for patients, for community, for country at large. That is the kind of audience we have, and I feel personally very proud to be with you all and speak here. Let me start with Metropolis and then we move to MEDENGAGE. A Metropolis, a company with a proven track record of 40 years of serving patients, helping doctors through their good diagnostic tests, which are done ethically with lot of emotions as if it is my own family sample, to do full justice on quality, cost, as well as efficiency, communicate to the doctors results in time, and help them interpret so that they can help the patients. This has been culture of the organization for years together. And a time came where we thought, okay, this, what we built as a company today, it should go and help the country. Sorry. Down? Okay. It should go and help the country at large. We should be participating with government and helping them improve quality of diagnostic labs across the country and be with them to support in the drive which government is doing these days. And hence, we took another area which is helping medical students. These medical students who are future of medical community across the country, who is going to help patients and doctors and country at large. And that is where MEDENGAGE program got conceived, and we are very proud. The pace at which it is becoming popular, it is getting accepted. I am seeing in every year it is going to reach bigger and bigger milestone. We are going to hear lots of details about MEDENGAGE program, but let me make a good beginning from two people who are true inspiration for it. I'm going to invite our Managing Director, Amira Shah, to begin, who has been having a vision, who has been thinking several years beyond today and guiding all of us on what to do, how to do, and she's true motivation for us. We will begin with her, and after that, we cannot forget the source from where all this culture and emotions are coming, and that is our founder, Dr. Sushil Shah. So let's hear both of them one by one. Let's start with Amira Shah first. Thank you.
Thank you, Nilesh, and good morning to everybody there. I really wish I could have been there in person. The fundamental premise for healthcare starts with the Hippocratic oath taken by medical professionals of do no harm. It is the foundational element of why all of us do what we do every day. In healthcare, all of us strive and put our best to take care of patients so that they can live healthily and happily. Metropolis has been built on the premise that we must first focus deeply about doctors and patients and society, and everything else comes next. This is visible in how we think, how we operate, and the choices we make every day. Never taking shortcuts, never choosing commerce over science, and always supporting the doctor to make the best decision for the patient. Diagnostics impacts 70% of the decisions made by the doctor for treatment. And therefore, whoever says that diagnostics is becoming commoditized or all labs give the same results just needs to speak with the oncologist or the neurologist who is about to cut out an organ from a patient's body on the trust that the diagnostic report is accurate. I have grown up in a home of highly ethical doctors, and I know the moral pressure that comes when a doctor is making a life and death decision for a patient, and how they doubt themselves and all their information and need to be 100% sure that they are making the right call before they make these decisions. Accurate diagnostics is the stepping stone to accurate treatment, and without this, none of us can live up to the Hippocratic oath. Metropolis Healthcare is all about supporting and empowering the doctor who treats patients. We are who we are because doctors believe in us and give us the motivation to pursue excellence in diagnostics and bring the best and the latest from all across the world to our Indian patients. In the future, diagnostics will be all about super specialization, the best talent and expertise, partnering with the doctor to interpret the reports, using artificial intelligence and deep learning to give trend reports and more information that they would need. And the 100,000 plus doctors that we actually work with on a day to day basis all across India, we want to continue to partner for them to make better decisions. As we know, everything will start with genomics in the future. And understanding the patient's DNA will be the key to making diagnostics personalized, but also medicines personalized and treatment completely personalized for every patient. We have always been a pioneer in our industry, and we will continue to remain at the cutting edge of science and advanced diagnostics. As a doctor, you can turn to us for anything and everything under the pathology banner, and we will be there to help. We look forward to this future with the new generation of doctors in our country, and we can only vow that we will do everything possible to make life easier for the doctor in treating their patient, as we know how hard life is for doctors and how much you do for us as a society. My deepest gratitude to all doctors sitting in our audience today and all across our country. And MEDENGAGE is our small way of giving back to our doctors in India. Jai Hind. Thank you so much.
Good morning, everyone. First and foremost, my heartiest thanks to Mr. Naveen Sona, who is the Health Secretary of Maharashtra government, for having graced the occasion. Our other chief guest, that is our Minister, Mr. Mangal Prabhat Lodha, is going to come shortly later, maybe around 1 o'clock. Metropolis has been here for 4 decades in Bombay. So everybody knows what it is all about. So I think instead of going and talking about what we are and what we are not, I'm going to only talk about some lesser known facts about Metropolis, which a whole lot of you may not be aware. And this may make it a little more interesting. I've been allotted 5 minutes, but I think I'm going to take a little longer to enumerate these. See, the first thing is in 1981, when I started my lab, I went and visited one of the well-known pathologists at that time. And I went to him for guidance and I told him, sir, I'm starting. Now, how do I go forward and make something out of this? So he said, what is your aim? I said, well, my aim is to be the top laboratory in Bombay within 10 years by 1990. I want to be a pan-India laboratory by 2000. And I want to be international laboratory which is present in multiple countries by 2010. That's in 30 years. So he laughed and he said, you know what, in 30 years, you will not be even a top lab in Bombay because it's going to be impossible to do that. It takes 30 years for you to even develop that much. So, and he said, how do you propose to get this? I said, are you going to be giving some incentives to the doctors? I said, no. He said, then are you very good at networking with, you have to network with the doctors and make success out of it? I said, no. He said, are you great at making good friends very fast? I said, no. He said, in that case, I think I foresee a future. In 5 years, we'll find you selling chana at the chopati. And unfortunately for me, his prophecy came wrong. And just to make it clear, by 1990, we were number one laboratory in Bombay in 10 years. By 2000, we were pan-India. We had almost all the place. And by 2010, we already had our presence in 13 countries across the world. So I think we managed to achieve that in spite of all the doomsdays that the people were. Now, I'll just come to some of the unknown achievements that we have, which are not very commonly known. First and foremost is, of course, we were the first referral laboratory to be started in India. There was no concept of a referral laboratory in those days. And there were only few referral laboratories in Europe and USA. There was no such concept. So we were the first referral laboratory to start. Now, it was a double-edged sword, because when you said referral laboratory, means you are going to be doing only specialized tests. And those days, those specialized tests, the demand for those was very, very few and far. There were hardly any samples. So, just to do that and survive on that was a Herculean task. But anyway, I took that risk. I started with that. But what we could achieve, which actually pushed us through, in spite of all the other negative reasons which were there, was the fact that I managed to establish something like 2,500 hospitals and laboratories as our collection centers. I didn't have the money to put my own centers. So I went and established these as collection centers all over India. And that, I think, was a move which clicked, after which we never had to look back, and it has been a steady progress. So I think that was the first, we were the first referral laboratory in India. Then the second thing is, in those days, there were no specialized tests except ANA, DNA, one or two things which are there, not even DNA, only ANA and rare things were there. So to start all these things, I introduced in India for the first time technique of radioimmunoassay. This radioimmunoassay is the technique which you use radioisotopes and do the tests. It's mainly done for hormones, oncogens, oncomarkers, and a lot of other things, drugs and multiple various things. So we started with that. There's the first one. Then in 87 or 86, I think, I remember we started with the HIV testing. And that time there was not a single HIV case in India, because nobody was doing the test. So obviously there was no case. So I know many doctors who came and told me, he said, okay, are you mad? There is no HIV in India. That time it had just picked up in some Western countries. He said, there is no HIV here. Why are you starting this test here? Why are you wasting your money? But again, I think we were proven right. And now you know what is the extent of HIV which is there. Second thing at that time we started was we participated and we were part of the team which came out with the first IVF baby, test tube baby in India in private sector. It was a team of Dr. Sadhna Desai and Dr. Mehru Ansotia, in which I was doing the pathology part and Dr. Amrish Dalal was doing the radiology part. So we were the team who got the first test tube baby in India. And today, of course, as you know, IVF is like every alternate building you find an IVF clinic now, Then the next thing which was there was we started molecular biology in 1991, when it was in a very, very nascent stage across the world. It had just started everywhere, and we are one of the first to start that in 91. The one point which I'm extremely proud of is our laboratory is accredited with CAP. CAP is a accreditation called College of American Pathology, which is the highest accreditation in the world. And this accreditation is given after very stringent inspection and very stringent rules. So not only we are CAP accredited since that time, but during our second or third inspection, which was there for renewal, we passed the CAP with no NC. NC means it's a non-compliance. And when you say non-compliance means there are few things which as per the CAP rules are lacking. So we passed without single NC. And I think this is very creditable because one of the inspectors only told us that there is no laboratory in the world which passes CAP with no NCs. So that itself was a great achievement for us. And I think 2-3 of the people who are sitting here, they were all responsible. Dr. Nilesh Shah, Kirti, Dr. Anuradha Murthy, they were all responsible at that time for having this achievement. I think which was really great. Hardly any laboratory even in USA which passes with no NCs. Now during COVID, it was something which was suddenly it burst on the scene and everybody was taken unawares. and nobody knew actually what to do, what not to do. Everyone was taken unawares. So we had a COVID testing facility, but that could do something to the tune of 700 or 800 tests per day. And here we were getting 25,000 tests a day. And you'll be surprised to know that within few days, in a very short time, we coped up and we continued to do 25,000 tests a day. We managed to establish the infrastructure, the staff training, managing the workload, getting the reports out, everything we managed 25, from what we had a capacity of 700 to 800 to 25,000. And similarly, most of the COVID test samples are collected at home. So when we collect these samples at home, obviously it has to be home visit. So we are geared up for the home visits up to 500 visits. We couldn't do more than that. And here we have to do to the tune of 8 to 10,000 home visits a day. So not only we have to do the visits during the day, but by evening we have to also give the reports by night. 8,000. Just imagine a city like Bombay to reach that many places all across Bombay is a Herculean task, believe it or not. And we didn't have the infrastructure, we didn't have the manpower. We created all this in a very short time, and we were able to cater to this. So I think this was one of the singular most biggest achievement we had. As I mentioned earlier, I think we are the only pathology laboratory in India which went international as early as in 2004. Today, of course, we are in multiple countries, but we were the first and the only lab from India which actually went international. And I know that time we were warned a lot by everyone that please don't get into this. It's a very dangerous zone to get into. You don't know anything about those countries. But I said, okay, no, I think this is going to be our future. So I'm going to do that. And we did it. And today we are already in 13, 14 countries doing a very successful job. Today, after this, we have over 4,000 patient centers. We have 130 plus full-fledged laboratories. And mind you, all these laboratories are our own. There are no franchisee laboratories. They all belong to us. Not a single one is a franchisee. We have a test menu of over 5,500 tests, which is probably one of the largest test menu in the world. And we have a workforce of 5,500 people. So I think we have really done a yeoman service, and we have managed to come to the level what any international laboratory would be. And lastly, I think another feather in our cap is, there is a awards called Entrepreneur of the Year by E&Y, Ernst & Young. This is not something which not many know. Now, this is the highest industry award which is there, one of the highest industry award, and a very prestigious one. And the recipient of these awards have been actually all who is who of India, like Ratan Tata, Mukesh Ambani, Kumar Mangalam Birla, Mr. Munjal, Uday Kotak, everybody. I mean, all the top people that you know have been the recipient of this award. But there are only 2 institutions in India where the recipient of this award are not 1 but 2 people from the company. Never it has happened. One is Tata's, where the first award was given to Mr. Ratan Tata, and second one to Mr. Chandrasekhar, who is now existing managing director and the CEO. And second is Metropolis, where I got in 2011, and my daughter got, Amira Shah is our managing director, she got 10 years later. So we are the only 2 companies who have got 2 awards from the same one. So I thought instead of wasting my time on telling what Metropolis does, I thought this is something which will be more interesting, which I think will be a bit of an eye-opener, which a lot of people don't know, because we are not very good at publicizing, to be very honest. Metropolis is not good at it at all. So I think it's a bit of an eye-opener. I'm sure you would look forward to hearing about this. Thank you very much. Thank you.
Thank you so much, sir. We loved hearing this and kept on feeling proud, but we felt double proud today when it came from you. And the way you said, and I witnessed lots of things of this, but I never enumerated the way you did. Thank you so much. I think you have set the tone and improved our motivation further. Let me little bit add, sir, I think what I have seen all my life working with him, that he has been super excited whenever we talk about new innovation, new test, new technology, new process. He has been super excited. But similar excitement, or maybe little more, I have seen when we talk about something to do with training or something to do with students. This is something which I have witnessed, and this is what has given a shape to MEDENGAGE program. MEDENGAGE program connected to student. Metropolis has ensured that our program gives 360-degree support to students, whether it is scholarship, whether it is research, or any other expectation they have. And I'm going to invite Dr. Kirti Chadha to come and tell us more detail about this program. And I'm sure you all will appreciate, and we look forward to you paying patient attention to it. Followed by this, I'm going to call Madam Duru Madam, where many of our theories, which are actually theories, and in practical life, how it will look. I think she's the lady who has been guiding us all our life, and she heads our Metropolis Foundation. So after Dr. Kirti, I'm going to request Madam to come forward and give us few words, please. Thank you.
Thank you. Thank you to everyone. How's the Josh, students? Can I have a cheer from all the winners? The winners in the house, raise your hands. So all the coveted seats in the auditorium belong to the winners because they are the future of tomorrow. So can I have a resounding applause for the MEDENGAGE winners? Today we have 82 students in the auditorium who have come from all across the country. We have a girl sitting here from Shillong, and I don't want to cry, so I'm going to jump into the presentation. I feel very strongly for each one of them. Let's start with the presentation. Okay. So I'm going to share with you how this started and where it is today. And whether we are there or not there, it will go on. That is what a legacy is all about. Sushil sir shared with you today the legacy of Metropolis, the 40-year-old legacy of Metropolis. First there was Sir, then Nilesh sir, then me, now it's Gen Next. And you will see the Gen Next, our torch bearers and our leading doctors of our organization as they, hold the baton from me henceforth. So that is what it's all about. You create an ecosystem where you do not need a connection. You do not need to know anybody. All that you need is what our Honorable PM talks about, Digital India, Make in India. So all that you need is an internet connection. And if you have an internet connection, and each one of you has that today, all thanks again to the government, and then you just need any gadget by which you can log on to Metropolis. You just have to type www.metropolisindia.com and you enter a universe of MEDENGAGE in which you get all the support that you need. And how this has grown over the last 4 to 5 years and where we are standing today and where I think it will go in the next 50 years is, I think, something that we'll all carry with us satisfactorily to our grave, right? So Sushil sir already shared with you that how it is all about taking the plunge, doing something that nobody has ever thought before. And that is how, one day he just reached out to Nilesh sir and me that, Nilesh and Kirti, let's do something for our community. Our doctors work so hard, but nobody takes care of them. They take care of everybody, but nobody takes care of them. Why don't we take care of them? And we all hear stories of violence against doctors. Kuch bhi problem hoti hai, doctor is blamed. In fact, the only time that you come to know there is a doctor over here is when there is an issue, right? So in fact, I always say, pathologist also is like a ghost. All the pathology departments used to be in, what do you call that, the basement of the organization, including Harvard. All the pathology departments used to be in the basements, but today they are all seeing light. Why? Because it's in the center of medicine today. And the moment anything goes wrong, report is delayed, report is not on time, everybody will come to know who's the pathologist of that hospital. Otherwise, they do not know. Same thing goes for clinicians. The moment a patient dies, the clinician is blamed. So this is not how it should be actually. And I don't know whether you all have seen our Med Talk series where we brought about all the problems and all the solutions. And we are coming forth with a very, very solution-based approach. So this was a solution that we thought of. What do doctors need? What do doctors need? Doctors need money. Yes, we need money because we don't earn well. We spend our entire life struggling, slogging, while all our fancy IT, MBA, finance colleagues start earning very well, become very independent. Unfortunately, doctors have a long incubation period. because medicine is difficult. How many people agree medicine is difficult? It's not easy. बॉस एक कोविड सीखने में पूरी दुनिया को 2 साल लग गए, तभी भी नहीं आया फिर, right? So it's very difficult. Medicine is very difficult. So when it is difficult, you have a long incubation period because you're dealing with lives. You're not dealing with files. You're dealing with lives. So you need money. So we said, okay, let us award people who deserve, some scholarship grants. Second thing you need is mentorship. Sometimes you just don't know what to do. You don't know which profession, which, subspecialty to opt for, which career to opt for. Today we have doctors, who are public healthcare, bureaucrats, government officials, they're doing different things. We have doctors who are CEOs of companies. We have doctors who are entrepreneurs, startup owners. We have doctors who are hardcore, brilliant ace clinicians, making sure every life matters. So you have all kind of doctors. But how does a young doctor decide what should I do? And that is why, we started the Med Talk series. It's a very interesting conversation where we have with a senior doctor and a young, brilliant, upcoming doctor. And we learn from both. I sit in the middle and learn from both. And the feedback that we've received is amazing. Because these senior doctors are opening out their hearts and sharing how they achieve. See, it's something to achieve something, but it's something to share it and not let it be only your propriety right. If you made it something successful, can you help somebody else also achieve success? We hear it in the business world, we hear it in other worlds, but now we are hearing it in medicine also. Third thing that doctors need is, they want to just do an internship sometimes. Today morning also, Nilesh sir said, you got an application, right, sir? Today, every day we receive an application from somebody. I just want to intern. I just want to get a vibe. I just want to get a sense, because every medical college has different infrastructure. But once a doctor is out, unfortunately, he's not judged by which college. He has to know it all. And how will he know it all? So he'll have to go to certain centers of excellence and do some internship or some research, and then that's how he learns. So we said, let's give them this also. We spoke to a lot of potential beneficiaries. We went to a lot of hospitals, a lot of colleges. We interviewed young doctors, and we realized that this is what young doctors need. So this MEDENGAGE scholarship program was actually conceptualized just how the doctors want it. And today also, if there's any feedback or anything that comes, we immediately include it in the program. So obviously, since we are a listed company, it has to go for board approval, but we have an amazing board who understands what doctors need, and it gets approval, and it is given from the next year onwards. So feel free, reach out, write to us at MEDENGAGE or at Metropolis, and we'll be happy to include anything else that we have missed out on, because times are changing, needs are changing. We understand that. There are various categories of awards, right? So each award is given for a particular reason. It takes a lot to become a doctor. One, you have to be good in academics. There is no alternate for that, guys. You are going to deal with a life. No matter which specialty you undergo, you have to study. There is no option to studying. So you have to be a scholar. You have to be. You have no option. But you also have to be a vibrant one sometimes. You cannot be morose. पेशेंट से ज़्यादा आप दुखी लग रहे हो, ऐसा नहीं होना चाहिए. पेशेंट को आपको देख के एक इंटरनल सेटिस्फैक्शन, कॉन्फिडेंस आना चाहिए कि ओके, आई हैव कम टू द राइट प्लेस, आई विल बी टेकन केयर ऑफ, राइट? You have to have the gift of the gab. So you have to be a wordsmith. You have to be able to explain to the patient and to the family what you have done, why you have done. There are various choices. There are various modalities of treatment. Why this is better? What are the options for the patient? I don't know how many of you all have read the book Interpreter of All Maladies. What does it say? It's written by an Indian, Pulitzer Prize winning. It says patient wants to know what he's fighting for, and a doctor should be able to explain that, right? So you have to be a wordsmith. You have to be a champion of all champions. You have to know everything. Somehow a doctor is expected to know everything, right? Of course, today you have tools, you have technology, but you should know what to refer to. So all our categories have been chosen very, very carefully. But we are not influencing anything. And that is why we've made it very, very unbiased. This is how it has grown over the years. You can see the journey, what Nilesh sir was alluding to, and it's grown so beautifully. And these are the number of awards that we'll be giving today. And 250 students have got the award this year, which is the highest ever. And out of these 250, 80 are here. Guys, cheer for yourself. I realized the power of digital this year. All this while we used to do it in such a difficult way, brick and mortar, pillar to post, college to college, hospital to hospital, spread the word. This is there, you can avail it. But this year, when we use the digital, I was like blown away. The power of social media, the power of digital outreach. And we got a record number of registrations and so many applications from areas which can untouched. It is impossible for anybody to travel across so many cities. But we got all these applications because of digital. And these are the different VOCs, the voice of the students. So this offline is also a voice of the students. Last 2-3 years, because of COVID, it was online, and we got a huge request that please do it offline. We want an offline, flesh and blood event, not an online event. But then we also got requests for online for people who cannot make it. So we turned it into a hybrid event, which is why it is hybrid today. And this is how the budget has grown. So I have to thank our Chief Financial Officer and the Board of Directors and the top management who have been so supporting. And the budget has just grown from year to year. We have very strict eligibility criteria. Final year MBBS is when we start. When you're final year MBBS, you start understanding what medicine is all about, right? And that is from where we start supporting you. And then all through your MD, MS, DNB. So these 4 years is what we cover. There are different phases, and there is a ENY. Sir just spoke about Ernst & Young. They are the partner for us. It is a totally unbiased award selection process, which happens through an external company, not by Metropolis. So I will not take you through the entire thing, but it's all very visible and you can read it. And these are some stories and some events. What is very, very interesting is that after the ENY does the selection, there is a MEDENGAGE jury. So can I have a big round of applause for our MEDENGAGE jury? They are all top healthcare professionals from the public and private sector, healthcare luminaries as we know them. And they are the people actually who then, sign off on the objective criteria. So as I said, it's completely online. People fill up their criteria. It's a scoring system, completely objective, completely automated. Then it goes to an external agency, Ernst & Young, who, validates the whole thing. And then it again goes to the jury, who approves the whole thing. So we did get some requests. Some people thought they were this, they were better suited as this. But trust me, guys, your senior doctors know better than you what you are shaping up to be. So trust them, trust your seniors, because experience matters. But however, 1 or 2 requests that we got, we have taken approval and we've included them. So on that note, I would just like to close this segment and invite Duru Madam, our chairperson of the Metropolis Foundation, to share. This was one thing that the Metropolis Foundation does. But I think Duru ma'am here will be able to explain to us and take you through what else does Metropolis Foundation do, because there is so much more that we are doing. Thank you.
Good morning, everyone. First of all, thank you for being here, and thank you, Mr. Hona, for honoring us with your presence. I'm currently the chair of the Metropolis Foundation, and I think this probably has come not because I'm Mrs. Sushil Shah, it's because I have been involved in public health for a long, long time. Right from 2000 onwards, I have believed that it's the youth of our country who are going to be the future generation of this country. And we need to keep them healthy, and unless we keep them healthy, we are not going to have healthy citizens of India. And hence, the target was first the young people. As a gynecologist, I realized, and as a mother of 2 daughters, that my girls knew much more than their friends who were not having parents as doctors. So I embarked onto a journey of creating information on reproductive and sexual health. This was information which was not available anywhere. We were in the year 2000. There was not internet at that time. There was no social media. There was nothing. So in short, we did a 10-year program where we went to schools. We gradually graduated in those 10 years. We started with 10 years, starting about myths of puberty, myths of menstruation, menstrual hygiene, which nobody talked about. We had to go to schools, went to 5th to 7th standard, I had Johnson & Johnson to support me where we never talked about J&J. It was called the Growing Up Program, and this was their CSR project, which they committed to me for 10 years. I had 1,000 volunteer group, of which one of them is very much here today. She stood by my side, Dr. Safla Shroff, who is currently the trustee of Metropolis Foundation along with me. She is a gynecologist and who has been my student and become a dear, dear friend, almost family. So you see, we started with 5th to 7th standard, talking to kids about puberty, talking about all the issues which I talked about. Gradually went on to the 8th and 10th standard, where we talked about reproduction, we talked about, unwanted pregnancies, we talked about unsafe sex. Those were the days where HIV was very much coming in. We talked about preventing HIV, we talked about contraception, we went to colleges, we covered more than 8 million kids physically through 1,000 volunteer team of gynecologists all over the country. We worked under the banner of Foxy. After we did that, after a year or two, I realized that we are not reaching out to the girls who are school dropouts. We are not reaching out to rural India. And that's when we started the program called Kishori, where we worked in Dharavi, we worked with the girls over there. And frankly, those girls have no time to come and listen, or their mothers don't have the time to send their girls for such information. So we offered them skills. We offered them skills so that they can be financially self-sufficient. It's important to make a girl self-sufficient because today, with so many divorces happening, with so many women remaining single, it's important for them to be self-sufficient and not to be dependent on their husbands. It gives them a sense of fulfillment and independence, that they can do it on their own. It gives them a feeling of confidence. We've seen these young girls grow. In the Dharavi project, it was amazing, absolutely. We saw them grow. We asked them what skills they want to learn. Those days they wanted to learn about beauty, makeup, hairdressing, tailoring, etc. We worked in collaboration with the Sion Hospital and UNICEF. And there I met Dr. Prakash Gurnani, who was heading that unit for this particular project. And today I've worked with him continuously, even today, and he is also one of the trustees of Metropolis Foundation. An amazing man. Unfortunately, today and his family, all three of them are down with COVID, and hence he could not attend. But today what we are doing is similar. What we are doing is similar through the Metropolis Foundation is we are reaching out to the young. We are reaching out to the young mainly through the Too Shy to Ask app. This is an app we have developed digitally, and it's reaching out through various urban areas and rural areas. Unfortunately, in rural areas, the girls don't have their own phones. The only phone belongs only to their father, who does not want to share it with anyone else. Today, there's so much of internet available, there's so much of wrong information available about sexuality, that as doctors, we can give the right information so that we can prevent unsafe abortions, unwanted pregnancies. There's so much of sexuality today that in my own clinic, I see a girl who's got 3 to 4 partners going on in a year. A girl having 3 to 4 partners. There's so much of vaginal infection and sexual infection that we need to control it, because if they have health issues later, which we all know can happen, because they're all exposed to HIV, they're exposed to herpes, they're exposed to hepatitis B, they're exposed to all kinds of infections, HPV, which can lead to cancer of the cervix. So this is something we have been working in rural areas for the past 1 year, and we have found that there's amazing amount of information being given to them. We have the app reaching out in 5 languages currently today, which includes Marathi, Hindi, Tamil, Bengali, English, Hindi. So we are reaching out to the young people abroad, out of the urban cities, but we are doing it also through NGOs. And the skills we are teaching them today are English, we are teaching them computers, and we are teaching them self-defense. I think self-defense for a woman is extremely important because of the sexual abuse they encounter. Girls going to schools in rural areas have to pass through very dense areas where they get waylaid by the boys of the village, and they get sexually abused. At nights, when they didn't have toilets to go to, they went out into the fields and they were attacked. So they need self-defense definitely to protect themselves. This is all about prevention. This is all about prevention. Prevention is important for all of us. And we are dealing with prevention and we are focusing on reproductive and sexual health. Today, yes, the central government has done a lot of work in skilling young people, a lot of work in providing toilets to young people in schools. The school dropouts, which happen mainly in villages, is because the girls don't have a private toilet to go to. They had, holes in their in the toilet doors. They had toilet doors which didn't lock. So unfortunately, all that happened. And today, we are in a better world today. We are in a much, much better state today, thanks to our government. And I think we have done a great job with taking care of the young people. But we have a lot way to go. In my practice, I see a lot of young women who are in great careers. They are presidents, they are vice presidents of various companies. I've treated ministers' wives, I've treated, all kinds of people. The question is what's happening in rural India? We need to address that. And that is something I'm sure our health secretary who's here will collaborate with us to work towards a rural India and work towards women and girls who do not have access to all this information. I think I want to talk about Metropolis Foundation. I could keep talking, but I know I have a limited time. And besides MEDENGAGE, which has been a brilliant program wherein we are giving back to the young people. So congratulations to all of you who have won the event this year. And I have only two messages for all of you. I want you to have empathy when you treat your patients. Treat every patient as your own family so that you'll never go wrong. You'll never go wrong if you think of that patient as your own wife, as your own sister, as your own daughter, as your own mother. You will never go wrong. So please have empathy for your patients. That's one message as you go along in life. The second is never feel bad when there's a failure. All of us have gone through failures, but stand up again and look forward. There's a lot to do. And each one of you, I know, since you have been award winners, even if you're not award winners, even if you haven't won the award, each one of you will do a lot for the society. And I think once the government sees the amount of empathy within you, I think everything will go straight for the doctors today. So thank you very much for being here, and I'm very, very happy that you all have come.
Madam, thank you so much. I'm absolutely emotionally touched, and I'm sure all of you are as well. I was not looking forward to this level of depth and which you have pleasantly surprised us with. So friends, if you notice today, we have had our MD talking about future, our MD talking about connecting patients and lab and doing contributing to medical fraternity in big way, followed by which we heard success story of Metropolis Lab from our founder chairman, who has been visionary, who has been the source for all this good work. Dr. Kirti talked about MEDENGAGE program for the talent of future, all the students who are here and the ones who are online. And connected to that, we heard emotionally a talk from Madam about public health and how to keep patient first and so on. And to combine all this, we have one person who can have a full vision. We talked about public health, we talked about patients' health and many more things. But somebody who can combine and give us his perspective because he's seeing larger picture is our health secretary. So I want you all to clap for somebody whom we are looking forward to hear, Mr. Naveen Sona, Principal Secretary, Health Department, Government of Maharashtra. Mr. Sona has been quite keen in systems design, public policy, working with political executives, and database policy design. He is a combination of all the discussions which we had so far, and we will be very eager to hear from you, sir. May I invite Mr. Sona here. Thank you.
Good morning to everyone. Dr. Sushil Shah, Chairman Metropolis, Dr. Duru Shah, speakers from earlier, Dr. Nilesh, Dr. Kirti, uh, Dr. Shroff, and other dignitaries present here, and students and friends. Thank you for a very wonderful start for this day, and the range of speeches I heard earlier. It's a staggering range and very inspiring. It's very inspiring to see the journey that Metropolis has taken, the vision. When we look at innovation and recognition of talent in the medical community, the main thing is to have a vision, and I'm very, very glad to be part of this program, and Dr. Sushil's vision and how he has built this from scratch. I think it's a big inspiration to anyone in any field, not alone medicine, and it requires tremendous amount of hard work and drive to reach where Metropolis. First of all, I'd like to congratulate Metropolis for this whole engagement with the students. It's a staggering number in the recognition and the amount of the awards. I think very few people realize how much you're giving back to society, and I mean it's a fabulous effort. At the same time, I would also like to mention how I had earlier had engaged with Metropolis through the CSR part, where Metropolis had taken a huge had been a huge contributor for TB program, if I'm not mistaken. That is what we call Nikshay Mitra, which is a support to TB patients by donating food, because nutritional support is a very fundamental thing. With this, let me give a small background about Maharashtra's healthcare system, which I deal with. It's a huge state, so we have we have more than 20,000 locations where we provide services. That's almost close to 11,000 sub-centers. This is the cutting edge. We have about 1,900 PHCs, 250 plus hospitals, couple of super specialty hospitals which we run. We have more than 20,000 doctors in our department, and believe it or not, close to 2 lakh professionals, including nurses and paramedical and laboratory technicians and imaging technicians and support services. And we have a budget of about 2.5 almost 2.7 billion US dollars, and put it on a global scale. So it's a huge setup, and health policy is a very complex thing. It's not just clinical management or the clinical protocols, but the overall indicators of health, which I think most of the doctors here would know. But I'm just here since I'm engaging with a lot of the newer minds, the students, the award winners. I thought I'll structure this speech in a couple of parts. So one thing is, I deal with these systems. I have a little bit background about myself. I think Dr. Kirti said, medicine is really tough, right? So I got into medicine and engineering at the same time. I joined medicine and my engineering results came a little later. Then I took the big decision, the most horrible decision of my life, and I had to choose these two diverging paths. So finally I took a call like, okay, medicine is too tough, right? So I took engineering. So I'm basically a mechanical engineer with a lot of IT background. So in an alternate reality, multiverse and all that, I would have been a doctor. I still feel, if life offers more than one opportunity, I would even now, take a sabbatical of 5 years and do medicine again, because I'm really passionate about it, even though, I'm in a different field. So, talking about innovation in medicine, Dr. Sushil himself is an innovator, because he's carved out a path in this field, and it has become a kind of a benchmark. So, what is innovation? If you look at what is the biggest innovation in medicine, do you think it's going to be like $1 billion industry somewhere, research team sitting, working for years together? Maybe, maybe not. There are greatest innovations which have come about in medicine were long before computers. The basic hypodermic needle or the stent didn't have computers when they were invented. They invented by doctors. We take it for granted. We think that's all right. It's there. We take it for granted. But innovation is an attitude. Innovation is not taking things for granted, but looking for a new way of doing things. Where we were taught about innovation is to take things apart, take your systems apart and look at every single component and see, is there a better way to do it? And medicine has given us so much. How many of you have heard of John Snow? Great. So all we know about GIS, Geographical Information System, comes from John Snow mapping cholera cases in the 19th century London, where there were so many deaths, and they could not find the focal point of where it is coming on. So he started mapping it on a map, putting the cases, and we found that it all centers around one hand pump which was infected, and that spread. So entire world of GIS came out of health. The other thing is, what can you do for public health? Have you heard of, I think many of you would have read Atul Gawande. How many of you have read his books? I would expect more hands, but very inspiring. Please read the Checklist Manifesto by Atul Gawande. It's a life-changing book for me, where simple things, nothing other than a hand wash campaign for doctors and nurses have changed public health and hospital borne infections, reduced mortality and morbidity by huge numbers. Small changes, you don't need multi-billion-dollar research. It's a systems perspective. We have to change our way of doing things. So these bright minds, I think, will come up with more innovations. Now, being an engineer, I'm going to take a minute with kind permission of the organizers to actually elaborate. There's so much talk about AI and machine learning. So I trained in this. I have done courses with MIT USA on IoT and in big data. So I do keep writing about machine learning and so on. So as a person who's formally learned it, I think we have to know that the fundamental thing, a simple way to understand this is, as doctors, I don't know how much IT is being taught to doctors, is you always know that it is input, process, output, but in ML, it's slightly reversed. You know the output you want, you sometimes give the input. Actually, it is a process discovery. The algorithm is discovered by the machine. You will probably, the output is actually the algorithm in machine learning, which is impossible for humans to do. As an example, diagnostics, the next generation of diagnostics is highly AI based, where we saw a presentation on, we are actually engaging with tuberculosis detection through X-ray imaging. The next generation is iris scans. iris scan being mapped by AI is predicting way more diseases, hidden diseases, almost as good as genome sequencing. This is some of the new cutting edge technology which is coming up. The other aspect which I think all doctors should learn is data. What is data and how we manage it is going to be the future of medicine. Diagnostics, since we are in the field of Metropolis, is all data. So how we are going to store it and use it and analyze it is a big challenge with the Honorable Prime Minister's big vision. We have the National Digital Health Mission. The Ayushman Bharat Digital Health Mission is going to be a game changer. Please look up the website. This is a whole ecosystem which is being built, like your Aadhaar, like your UPI. 10 years back, there was no UPI. Now we just pay money seamlessly across banks. There was a time when the credit card would operate only in your own bank. So I was part of a lot of that initial systems where the finance ministry was building, and the planning commission in 2012-13 were building systems to interconnect banking. Now what we take for granted has taken 10 years, 12 years to do. So Digital Health Mission is going to give you a huge platform where the apps are going to be developed by anybody. It could be Metropolis, it could be where services are going to be available online, and the patient data is going to be available online. I had spoken to Dr. Shah earlier about engaging with the government on the ABHA, the Ayushman Bharat Health Account, which is a unique patient ID created free. It's basically a cloud account for free given to anybody. So I would love to have engagement of Metropolis. We'll formally invite you for if you just put this identifier, it's a unique identifier in any of all of your diagnostic tests, you will be a pioneer in the country. And that would start a huge cascading effect of digitizing this information. So I invite Metropolis to give a thought on this. And lastly, what I think is future, all these bright minds, I think the technology, as a technologist, so many things are happening. Genomics was mentioned. IoT is going to change. Again, the diagnostic industry is going to change rapidly because of Internet of Things, Internet of Medical Things. Please look it up. You know, we are going to live in a world of sensors which will be transmitting information on live, and that's going to change how medicine combined with the telemedicine, telemetry. It's going to change way we are going to do. And I'm very keen that even 3D printing is going to take off in the next 10, 15 years. We have gastroenterologists, probably don't be far away in another 15 years. You'll be probably, do in vivo printing of some parts of the body inside your, as a surgery. You may be that, the trials are going on. Can you print vascular tissue in the body? That's the kind of things people are talking about. So it's a very exciting field, and these bright minds are going to be part of the future of our country, our innovators. I think I've overshot my time a bit, but I wish a grand success in the future careers for all the winners, and it's an amazing inspiration. And the main thing is to not lose that fire you have as a student. I believe in lifelong learning. I was learning French language long back. So I had a 76-year-old co-student, 76, and he had just started learning French. There's no limit to learning, and the world is rapidly progressing. So once again, thanks for having me here, and I would be most happy to engage with these students even at a later stage. We don't take medical interns, but we are open to innovative ideas, and definitely we could look at through the CSR, engage with these bright doctors, and definitely it will be a learning experience for all of us. Thank you so much, and congrats to everyone again.
Very exciting talk, lots of knowledge, lots of gyan, lots of future good things which are happening, gives us a lot of excitement. So thank you so much for this. I'm going to request Sushil sir to come forward and felicitate Mr. Sona and give his autobiography as well. I'm going to request Dr. Kirti also to come up now and announce the Champions Award. So it can be with Mr. Sona's hand, the Champions Award. Sir, 2 more minutes.
Okay, excited everyone? So to give away the first set of awards, Champion of Champions, I would like to invite a few special people, especially the MEDENGAGE jury. Can I request the MEDENGAGE jury members to please come forward? Dr. Rajashri Kelkar, Dr. Pradeep Vaideswar, Dr. Amita Joshi, Dr. Rajiv, and can I also request Dr. Safala from the foundation? And can I request our senior key opinion leaders who've joined us today as orators, Dr. Prasanna sir, please come up on stage. We have lots of awardees, so each awardee can feel privileged to receive an award from one of our illuminaries. So first, a big round of applause for these leaders. As I call upon the name of the winners, I would request each winner to come up on stage and take their trophy and certificate from one of the luminaries here. Aditya Khandelkar from Jupiter Hospital, Thane. डॉक्टर्स का स्टोरी बेचारा अपना अवार्ड खुद ही पकड़ के खुद ही दे रहा है बिग राउंड ऑफ अप्लॉज फॉर आदित्य stay Aditya, everyone request you to stay for a later big round of this thing. Just stay on the side here, yeah. Akatya Vidushi from MGM Medical College, Kamote. Bansal, GS Medical College, Parel. Dr. Subhashri Subhadarshini, Topiwala National Medical College. Jay Prakash Suresh Kaura from Armed Forces Medical College, Pune. And those of you whose parents have come with them, I would request the parents to accompany the child. ये आपका भी award है. आपने actually उसको doctor बनाया है. आप please साथ में आओ. I would request the parents, the friend, the spouse, the boyfriend, the girlfriend, whoever has accompanied the champion, please come with that person on stage and share the moment. Krish Kirajani, Kerala Medical College Hospital, Nerul. Give a round of applause for the parents. Our parents make us what we are, guys. Big round of applause for all the parents. Those who are here and those who are not here. Lakshita Joshi, GS Medical College, Parel. Nikita Chandak, GS Medical College, Parel. Sai Kiran Kochana, Kakatiya Medical College, Warangal. Here the names, the states. We have touched 29 states and 516 cities of India. Saumitriya Ginodia, GS Medical College, Parel. Vidhi Vora, Lokmanya Tilak Municipal Hospital, Sion. You all must have seen Vidhi in our Med Talk star. Vishwa Mehta, Gitanjali Medical College, Udaipur. Udaipur. How many for Udaipur? Give it a round of applause, guys. Amia Machave, GS Medical College, Parel. Debayan Banerjee, GS Medical College, Parel. Sorry, the champion of champions is done. My mistake. Debayan is a pedagogue winner. Okay, so we end with that. Wait. Sir, please stay back on stage. Sir, please stay back on stage. So I would request one parent, one jury member, and one student to come and share their thoughts right now, their story or their thoughts. Just a minute, please. But one parent, Aiye, please.
Good afternoon to everyone. Basically, I'm a civil engineer. My name is SP Mehta. Incidentally, during one function, my eldest daughter, she suffered through burn, and we could not save her in about a 1 month treatment. Then I took a resolution that whatever my children's, I will make them doctor. My two daughters are postgraduate doctors, and this Mr. Vishwa Mehta is a topper of his medical college since last 5 years, and I hope with the blessings of all the dignitaries present here and all the people, he will rise and will serve the society. Thank you very much.
Want to say something? Sure.
Good morning, one and all present here. Thank you so much, Metropolis MEDENGAGE. This is my third time and it's my hat trick. I'm winning it, but this time I won it in my dream category, Champion of Champions. Like, I have been trying to win this right from the first time when I had applied for, and finally it's here. Like, I'm feeling short of words to tell. Dr. Kirti Chadha ma'am has been anchoring from the where I had started, and she is a great source of inspiration for me. Like, when in the morning I just saw her, I was just eyes stuck, like, ma'am, meeting ma'am in physically. tears roll down, but I'm missing my support system. My entire supports, means I was in Odisha doing my MBBS from when I'm opting this award. But right now I'm doing my post-graduation in community. My dream branch, from the second year of my MBBS, I wanted to do PSM because my dream is to serve in WHO. So I'm in my dream branch and one of my dream college too, Topiwala National Medical College. And I have my entire support system in Odisha, but I have my
Family here now in Mumbai.
yeah, I have, and my biggest support system, my colleague, whom I regard as my elder sister, Dr. Disha. So she has been like, when I left my hometown for the first time, and when I was homesick, she and along with Dr. Vishal, who is not here, they both have supported me like anything. I suffered from chickenpox. I was damn homesick, but they have supported me like anything. Disha, I love you. And this prize is entire for my entire support system. And thank you, MEDENGAGE. Finally, I won it after 3 years. 3 years, finally.
Come please, before you say, so we got a request that can I apply again? Of course you can apply again. And it is important to apply again because consistency is important, right? Doctors don't stop learning or reading till the day we retire. So, of course, doctors, we cannot stop them. First year is first year, second year, final year is final year. You have excelled year after year. You deserve to be here year after year. So there is no restriction. You can keep on applying year after year. Okay?
Sorry. Thank you. Thank you. A little bit of static. I think that's okay. I won't take a lot of your time, just a minute. I think I just want to stand here and for 30 seconds and thank the people behind all of it, because being a third-year resident myself right now, I don't know how many of you here have worked through COVID. We've seen a lot of unfortunate patient situations the past 2 years, and Metropolis has been the most reliable diagnostic partner for most doctors across Mumbai. So I think a big round of applause to the accuracy of the reporting. We have run fever OPDs and COVID OPDs for months at a stretch, but the inflammatory marker reports that we've got from Metropolis have always been unmatched. And even higher investigations like paraneoplastic workup or autoimmune encephalitis workup, we have blind faith. I think most doctors in Mumbai and other metro cities would agree. So a big thank you to Metropolis for giving all of us this opportunity, and a bigger thank you from all of the patients who have their futures secured because of your laboratory workup. Thank you.
Thank you so much. That means a lot. I think all my colleagues back in the lab will be feeling so good today with this validation coming from the field that, our reports are trusted, treasured, and our effort is not going in vain. Thank you so much, young doctor. Anybody else wants to say anything? Come, ma'am.
Hello, I'm Dr. Rajeshri Kelkar. I'm one of the juries since last year. I know Kirti for quite some time, and when she gave me this invitation, I thought I'm really honored. And it was really very tough last year. It was almost 110 applicants, and really tough. I really did not know who to give how many marks, and when we were kids, I don't think anybody taught us to write papers or research or anything. And these kids, I was really amazed, and I kept on telling her that I'm really honored to have been a part of the jury, and I'm seriously thanking Metropolis for giving me this opportunity. And my all the best and hearty congratulations to all the winners. Thank you.
Sorry, one award was left. We have Prerna Kharichani. Can we have her on stage, please? And her parents. And can they say something? Yeah. These are Prerna's parents who've come to collect the award.
Good morning, everyone. This is the second time our daughter has won the Champions of Champion award consecutively. Today she couldn't be here, unfortunately. She's gone for a international medical elective program. So she's in the US at present. So we are here as proud parents to just collect her award on her behalf. Thank you so much.
Can I have a group picture with all the champion of champions, with the guest of honor and the luminaries? Come forward, everyone. Can I invite Sushil sir, Nilesh sir, Rakesh, Duru ma'am to please join for a picture with the champion of champions? It's a moment for them. No, not at all. You are representing her. Thank you so much, everyone. I would like to invite Dr. Niranjan Patil on stage. He's the Associate Vice President of the Infectious Disease Department, the man behind the COVID lab, to take over the stage from here. And before that, we would like to have, So while Dr. Niranjan comes and settles in, we have the closing remarks of the first segment from our CEO. Can I please have the recording? He's abroad currently and feels bad of missing this event, but he sent his message for all of you.
A very good morning, everyone. It's an honor for me to participate virtually in this prestigious Metropolis CSR initiative, the MEDENGAGE Scholarship Summit. On behalf of Metropolis, I would like to personally thank all of our distinguished dignitaries, including Chief Guest Honorable Mangal Pratap Loda, Guest of Honor Shri Naveen Sona, notable healthcare key opinion leaders, doctors, or partners from the press, for taking out time, especially on a Sunday morning, and of course, my dear, colleagues, to join us at this wonderful event. I really liked the concept of MEDENGAGE medical outreach program, which has been developed by our respected chairman, Dr. Sushil Shah, years back. It's incredible to see how the MEDENGAGE scholarship program has evolved and touched our next generation of doctors across the country with each passing year. Furthermore, despite being a scholarship program, it has provided many students with an opportunity to learn from and interact with renowned healthcare professionals and scientific experts. Adding to all that, MEDENGAGE by Metropolis has truly transformed the lives of students and has several powerful and authentic stories to tell about our winners. These stories are powerful testaments to the students' passion and resilience in handling their lives and turning them around beautifully. Med-Engagement program demonstrates to be a purpose-driven and noble initiative that stands for the betterment of the medical fraternity by supporting such young medical talent. On this note, I would like to personally congratulate all the Med-Engage scholarship recipients and engage them to go above and beyond to pursue their passion and contribute to the healthcare ecosystem. Finally, I would like to congratulate and thank Dr. Durusha, Chairperson of Metropolis Foundation, and other managing trustees, Dr. Prakash Gurnani, Dr. Safla Shroff, as well as Dr. Kirti Chadda and her team for driving such inspiring and impactful CSR initiatives, and I wish them the very best in the coming years. I wish everyone a successful summit today. Thank you very much.
Before starting the next segment, I also just want to felicitate our 3 MEDENGAGE jury members, 4 MEDENGAGE jury members. Can Sushil sir and Nilesh sir please come up on stage, and Rakesh? Can we just felicitate the MEDENGAGE jury members who's taken out time from their precious and busy schedules to help us? Yeah. Dr. Amita Joshi ma'am, Dr. Pradeep Vaideshwar sir, Dr. Rajiv Joshi and Dr. Rajshri Kelkar, please come up on stage. A big round of applause for the MEDENGAGE jury members. There are many jury members who are in different parts of the country and they have not been able to join, but we thank them from the bottom of our hearts wholeheartedly for, taking out time. This is all gratis, like many other things that doctors do. आधी चीज़ों के लिए हमको पैसे नहीं मिलते हैं, फिर भी हम उतनी श्रद्धा से करते हैं और हमको इनको थैंक करना चाहिए जिन्होंने ये टाइम निकाला है. ओके
Being associated with KEM Hospital for over almost 40 years, including my student days, I've always been associated with students and I've always been in charge of teaching programs, etc. So I'm very happy after retirement also. I got to read their essays and all, and I must say that these students are excellent. It was really, really hard. As Dr. Kelkar said, it was very hard for any of us to give marks and judge, give rank to one person over the other. It was, believe me, it was really, really hard and tough decision for us. But I'm very, very happy that I got to do this evaluation. I also learned a lot in the process. And I've done it 2-3 times by now, and every time I learn a lot from the students. Thank you very much. Thank you all of you.
Good morning all. In our school days, we used to refer a book called as Renan Martin for English Grammar, and where we were taught the superlatives were, good, better, and best. But as we started analyzing the students, the way they have written, it was best, bester, and bestest. So I'm really happy, and as Dr. Amita said, that this has been a learning for us, and we are learners for the lifetime. Thank you very much, MEDENGAGE, for giving me this opportunity. All the best to everyone.
So just hold it, we need a picture. So just hold it, we need a picture with the entire jury, please ma'am, don't go back unless you want to lose weight. Dr. Rajiv, something from you?
Hi, good morning all. Actually, I'm part of this event last 2 years, and we are partners with Metropolis since long as a healthcare providers. So I represented Asian Cancer Institute in Mumbai, and it is very difficult, as already our colleagues has already mentioned. It's a very difficult time when you evaluate so many candidates over the other, and somebody, almost all of them are securing same marks. So, but always, somebody excels the other one, and it is very difficult, and they always give us a task in such a way, it's very, 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 different altogether. So, the winners, everyone, the team, MEDENGAGE, I always, congratulate them for this event and being us as a jury. Thank you very much.
Duru ma'am and Dr. Safla, can I invite for a picture with the jury? And I think next time we're going to include a technical person in the jury to screen people using ChatGPT. It has to come from the brain. Okay. Thank you, everyone. Thank you, dear jury. Thank you, Foundation. Can we start the next segment? Yeah, Dr. Niranjan, sorry, I kept you waiting for too long after calling you. Sorry.
Thank you so much, ma'am, for motivating and inspiring each and every one of us here. So this gives me pleasure to conduct the next session, which is on gastroenterology. So it gives me great pleasure to invite upon stage the luminary Dr. Prasanna Shah sir, who is a consultant at Sefi Hospital, Bridge Candy Hospital, and Jaslok Hospital. His special interests are into interventional gastroenterology and obesity. So over to here, sir. Sir will be talking on recent trends and innovation in gastroenterology. Thank you so much.
Good morning, everybody. I hope everybody is awake. At the outset, I'd like to thank the Metropolis Foundation, Sushil Shah and his team, for doing a fantastic job and igniting such young minds and giving them the encouragement to go ahead with this. I was told that being a senior gastroenterologist, we would like some philosophy, some talk or something. I said, okay. Then last night they said, sir, it'll be nice if you could give some talk. So I said, oh my God, now what do I do? So mind me if, I run through my slides fast. It's going to be in two parts. I'm going to talk a bit about medicine, which you all should really listen to, and what's new coming in gastroenterology, which is very exciting, and a bit of my philosophy, which I will try and, guide you all. So gastroenterology 2023, I believe it's the age of endoscopy. And let me run through quickly the anatomy, and therefore I'll tell you what are the new things which are coming in basically in endoscopy. So diseases of the esophagus, we have, reflux, and for that we have new procedures called ARMA, GERDEX, and OM. That's for achalasia cardia. For stomach, we have something called endoscopic mucosal resections, that is EMR for early gastric cancers. We can shave off these tumors and they don't require surgeries. Similarly, endoscopic submucosal dissection. These are again for invasive tumors of the stomach, colon. We can do this. There's something called GPOM, which is coming up for diabetic gastroparesis. So we can now go in endoscopically and basically cut the fibers and make sure that the gastroparesis goes off. Where my interest comes in, and that's obesity, because if you see, there's a huge gap between medicine and surgery, and that unmet need is basically endoscopy. What we have is only 1% of our general population actually go in for bariatric surgery. So there's a new emerging branch called as endobariatric therapies which are coming up, and I think you should really look at it, because the root cause of all evil now is obesity. You name it, head to toe, we all have obesity problems. Similarly, the small intestine, what we have is duodenal mucosal resurfacing. It still has to get FDA approval, but this is a very simple thing. We just burn the mucosa of the small intestine, and you can reverse, let me tell you, reverse type 2 diabetes for at least 6 to 9 months, even in non-obese patients. So this is going to be a game changer. Similarly, large intestine, we have, as I said, I'd mentioned ESD. Then for the liver and the gallbladder, we have medical therapies. We have ERCP, EUS, which is pretty standard now, nothing new in that. And pancreas, again, we have stenting, and we have EUS and medical therapy. So this I just wanted to tell you purely just for gastroenterology, because let me tell you, when I started off medicine, I did not have choices which you all have. You all are spoiled for choices, and that can lead to even confusion in your mind. So just be focused as to what your heart wants, what your heart desires. You can just go for that. So this is one thing which I wanted to tell you. The endobariatric procedures which are now US FDA approved are the Orbera balloon, the Spatz balloon, and the reshaped duo balloon. I'm sorry, the video is not on, but it just goes to show that, yeah, it's on. So basically what we do is, it's a thin silicone balloon which we pass through the mouth. It's placed in the fundus of the stomach. It's all done endoscopically. It takes around 20 minutes. Patient is in your OPD for around 1 hour. And you see this white balloon, that's the silicone balloon which is there, and that the black thing is a scope. That's called the endoscope. And we are seeing the stomach, the body of the stomach, and the fundus. And what we do is we just instill water into the balloon. It's around 500 cc of saline with methylene blue. Why methylene blue? Because if the balloon bursts, then you'll pass blue or green urine, which you know that the balloon has burst, and the patient can come back to you and you can remove it. The balloon does not pass through the pyloric opening. It is designed in such a way that it will be retained in the stomach. So this is a short video, and basically the do's and don'ts is, as the patient comes in for an endoscopy, he has to be fasting. And the post-op, the side effects of the balloon would be a bit of nausea, vomiting for the first 24 to 48 hours, by which we can treat with the medicines. And that's about it. They have to go through a hypocaloric diet, exercise every day 45 minutes. There are no shortcuts in medicines, so there are no shortcuts in therapies. So please understand that, and please be sure that obesity is a killer. Take it up as a chemotherapy regime, because chemotherapy people take really seriously. Oh my God, what's happened? So similarly with obesity, please keep the same mindset. You can see the balloon which is getting inflated with methylene blue. And once this is done, the balloon is placed in the fundus, and then that's it. The SPATS is an adjustable balloon. The only difference is that we can inflate and deflate the balloon every 3 months based on if the weight becomes stable, or if the weight does not fall further down, the patient comes back, we instill water into the balloon, and they again go back, they again have weight loss. So these are now FDA approved procedures. The new kid on the block for us is ESG, that is endoscopic sleeve gastroplasty. Please remember, ESG is also surgical gastrectomy. It is not so. We are not cutting the stomach, because the first thing is, डॉक्टर साहब हमको पेट नहीं काटना है, so हम लोग पेट नहीं काट रहे हैं, आपका पेट सिर्फ छोटा कर रहे हैं, and that's it. We're going to make a small gastric pouch which will remain for 3 years, and you can expect 50 to 80% of your excess body weight loss gradually going down in the next 3 years. So, as I've said, in the fight against obesity, bariatric surgery is currently the most effective treatment, which I do not disapprove of. I completely agree. However, only 1 to 2% of qualified patients receive this surgery, and that's a huge number in our country of 1.4 billion. Due to limited access, patient choice, and associated risks and high costs entailed in surgery. Similarly, a novel treatment method called sleeve gastroplasty offers a new solution for obese patients. ESG, minimally invasive, safe, cost-effective weight loss intervention. So what is it? Basically, it's an endoscopy. It's a non-surgical procedure using an endoscope with a flexible tube with a light and camera, which is there in the scope. It basically reduces the size of the stomach by creating a sleeve of the stomach. We use a set of sutures. It comes from the incisura all the way up to the fundus, and then the stomach is made into a small little pouch. That's the video which is showing you that we pull in the gastric wall and we take sutures like what everybody is doing. The other new thing which still needs FDA approval are the self-assembling GI magnets. So basically we put 2 magnets into the small intestine and create pressure necrosis, and you're creating a bypass. So this is instead of undergoing a surgical bypass, you're now doing an endoscopic bypass. And these are basically self-assembling octagonal magnets delivering through an endoscope working channel. And this basically creates a bypass. And this is what it is. On day 4, you can see both the magnets. The magnets are deployed. And this is a laparoscopic view of the coupled magnets. And the anastomosis, look at it at 6 months. It's an absolutely clean anastomosis. So, and when you do a barium, you can see that there is a complete bypass. So these are new exciting things which are coming, and I thought it will be important for you all to know, because you all are just stepping into our field. So you all decide what you want to do. I'm here to pitch gastroenterology, if you can say so. And similarly, what I just wanted to end here saying that early results with intestinal to intestinal bypass suggest good weight loss and an improvement on A1C levels. So
Now they part of a little philosophy because they said I'm a senior gastroenterologist, so I like to give a bit of my philosophy to all you young fellows. I'm sure you've heard this saying, great power comes great responsibility. It's from the movie Spider-Man, okay, 2002. So I'm sure you all are the Gen Z. That's how I will call you doctors, Gen Z. So my important thing to you all is please focus on overall development. Remember that when the going gets tough, it's really tough and it's not going to get easy, and surely it will be in medicine. So do not give up because there are going to be ups and downs. When there is a down, there is going to be an up. When there is an up, don't get too elated, you will come down. Okay, it's a great leveler. Your purpose, remember why you choose medicine. Today you'll have friends joining startups with fancy packages. Do not get enamored by that, okay? Because what we earn in our lifetime is goodwill, and that goes a very long way, all right? So forget about the packages, forget about, these financial bank guys are earning so much, so and so. It's the goodwill which will count, and your name in good society will actually take you forward. As Gen Z, you're witnessing rapid growth in wealth accumulation in India versus the prior generations. So be responsible. That's all I want to say. Don't forget the patient as you see all these changes around you. You'll have artificial intelligence. Somebody talked about Chat GPT, but the art of medicine remains bedside manners, bedside medicines. That's the whole art of clinical medicine. Do not forget this. Metropolis is here to make our diagnosis 100%. So it's all a teamwork, but ultimately what comes down is clinical medicine. For your information, 27% of India's population is Gen Z, which are born after 1995. So India still has a low patient to doctor ratio. What your role is. So you decide what your role wants to be in this whole huge population. While you are digital natives, never forget the human touch in patient care. As I mentioned, Chat GPT, artificial intelligence, there's going to be a whole host of them. But patient care, clinical touch is what is very important. Yes, we have algorithms to help us save time, but ultimately being a good clinician, it is all about deciphering what is troubling your patient. See how you can incorporate technology into your patient care. These are all going to be tools. These are all going to be pillars for good practice. And at the end, I can only wishing you all the best for the future. And a very famous quote, which I really like, by John F. Kennedy, said, ask not what your country can do for you, but ask what you can do for your country. Thank you. Jai Hind.
Thank you so much, sir, for a wonderful and incredible knowledge feast that we had. I would like to call upon Dr. Anuradha Murthy Madam to give a token of appreciation and bouquet to sir. A round of applause, please.
Talked about our generations, but like father, like son, these are absolutely iconic times. And I think what we've really heard is that the gastroenterologists rule the roost. But thank you.
Please hand over. Thank you so much, sir. Thank you so much, ma'am. Now I would like to call upon Dr. Anurag Shrimal. Sir requires no introduction. Sir is a liver transplant surgeon, and his special areas of interest are living donor liver transplant and pediatric liver transplantation. So please. So we'll be talking on current concepts in liver transplants.
Uh, Good afternoon, all of you. And first of all, I would like to congratulate the Metropolis group, Dr. Shah sir and everybody, all the esteemed delegates here, and all the winners of the award. And I can feel the energy today in the area. Now, uh, uh, don't go with my slides. I was traveling and I reached this morning and I was just prepared something, but I will try to go through it. Slides. So, send it to madam. You don't have slides? That's okay. This was the PPT I have made. Is it possible to upload it if I can send it to you? There you Sure. So my apologies. I think my slides are getting uploaded. So meanwhile, I can just start about the talk that now being a young surgeon, I can tell you transplantation is a very, very young branch in itself. The first attempt at transplantation or liver transplant was in 1963, and the first successful attempt or the first success we gained was in 1968 by the famous Dr. Thomas Tarzal. Now, it's loading. Sure. Sure, sure, sure. Now coming back to what I was discussing, uh, now again transplantation as a science comes into picture with end stage organ failure, and all of us know that I mean we hate surgeons, we don't want surgery, but this is an area where all treatment modalities have failed, and that's where the role of transplantation comes in. Now, I just wanted to discuss a small case and bring up a few of the nuances of liver transplantation. So let the slides load in. So this is a child who presented to us at the age of 4 months. He was weighing barely 4.2 kilograms, and at the right from his birth, from day 3 or day 4, there was a timely diagnosis of biliary atresia, and by day 21, by the age of day 21, he had a surgery in the form of portoenterostomy, but as would happen more often than not, this surgery failed. So this child presented to us at an age of 4 months with a weight of 4.2 kilograms, with already having a decompensated chronic liver disease with jaundice, ascites, and growth failure. Now, to add to it was that there was no compatible blood group donor in the family. And then to add to it was the financial constraints. So, and the reason I have put this case up is that a message to all the students is do not give up. So this was a case where we thought that now what next? While we evaluated now what is called as a ABO incompatible blood transplant. So all of us know that we have preformed antibodies to with our blood group system, but the blood group system in children less than a year or less than 2 years is immature, and hence there are no antibodies, and we could transplant any blood group to any of the recipients. Now, while we were working it up, one of the distant aunt came forward for donation. Her blood group was different. Now, to our surprise, we found that the child had developed COVID, and probably that has led to a sensitization. And the child had blood group A antibodies in the system. With that, it added to our challenges. So this child then needed further therapies in the form of rituximab to control the antibody production, and then immunoadsorption or plasmapheresis. Now this weight of around 5 to 6 kg, this is one of the first few cases reported across the globe. Less than 5 such cases have been reported where a desensitization protocol has been followed. So okay, so that is what I was talking to you about. So now comes the situation. So just to take you through the history of transplantation, that the pioneers have been Dr. Starzl, Dr. Roy Kalne, and then came the recent advances in living donor liver transplantation. Just to briefly give you some ideas, that when we talk about living donor liver transplant and the, I'm so sorry. Sure. So when we talk about living donor liver transplant, we talk about a family member as a donor, and then when we talk about these small kids, you can see the segment 2 and 3 of the liver, and sometimes we need further small, what is called as a monosegmental graft, or it is almost like a custom-made graft for these children. So you can see that the right lobe graft on the right side, where we reconstruct the middle hepatic vein, and that has been the cornerstone of success of living donor liver transplant. But in the children, large grafts is a problem, and you can see how a graft has been reduced to kind of a custom-made graft for this child. Okay. Couple of other concepts I wanted to include in my talk was, one is about what is called as a domino liver transplant. Now, in certain conditions, say amyloidosis, there is a abnormality in the liver wherein certain enzymes are not produced, and this leads to deposition of an amyloid protein in the nerves, leading to peripheral neuropathy. But this happens over a period of 20 to 30 to 40 years, and they present to us as middle-aged adults. Now, if the treatment for this is the liver transplant, wherein this enzyme is produced by the new liver and the peripheral neuropathy stabilizes. But this liver which is coming out, which would otherwise go to laboratory for pathological studies, can actually be implanted into an individual where the expected life expectancy may not be 20 to 30 years. Say an individual who's already 60, 65-year-old, and hence this is what is called as a domino liver transplant, where rather than going to the laboratory, this liver goes into one more patient and gives life to one more individual. One more technique that is worth discussing with all of you, especially the new budding doctors, is what is called as orthoptic auxiliary partial orthoptic liver transplantation. Now, there are two special areas. One is acute liver failure, and one is patients with metabolic liver disease, where in future we perceive that gene therapy may be available and the target organ should be preserved. This concept could be used, and the idea is to help them get away from immunosuppression after recovery of the native organ or after gene therapy. Now, coming back to the same child, so this child underwent a living donor liver transplant with the aunt being a donor. We had a CRRT machine taking care of the plasmapheresis and immunoadsorption. We had an hyper-reduced graft. He had a prolonged course in the hospital. Can we play the video? Is it playing? Okay. So this child is now more than a year, and this is the first few steps that this child was taking. So the message I wanted to convey with this case to all the young students is, as doctors. One is keep reading, keep researching. You will find solutions to the new problems and new challenges that you face. Second is do not give up. A lot of teams had given up on this child, so do not give up. And the third is definitely go out of box. Think beyond what is known. Sometimes there may be a certain amount of risk involved, but that is where you will get the best for every patient. And I think with this, I'll end my talk. And this is what I think Metropolis is doing, wherein we get the best results for every single individual every time. Thank you so much.
Dr. Anurag Shimal sir. Now we like to call upon Dr. Anuradha Murthy madam to give a token of appreciation and a floral bouquet to sir. Sir himself is a Young Achiever Award. In 2018, he has received the Young Achievers Award in Times Health.
This is just to tell all the young doctors that Dr. Anurag has been a very integral part in actually a team. So when you are, if at all, contemplating diagnostics as an postgraduate option, the important thing is to work with the clinician. And for us, he has actually tailor-made the protocols which have been disseminated all over the country. So sometimes you can small steps can actually benefit a whole community, and these are very small instances, but I think eternally we are very grateful to you. Thank you.
Thank you so much, sir and madam. Sir, please stay around. So there is an announcement. There is a press conference that is going to commence very shortly. So we'll continue this session after the press conference. Thank you, everyone. I would request everyone to now please have their seats so that we can start with the next session. In fact, continue with the existing session which was going on. I request everyone to please be seated. Hello, everyone. I would just like to have your attention, please. We want to restart the session, so I'm requesting everyone to please be seated. Yeah. So thank you. I would just like to take this opportunity to talk something about our gastromet division, about what we do. So at Metropolis, we have this gastromet division which caters to the gastroenterologist and the hepatologist. We have a basket of 130 tests which cover infectious hepatitis, non-infectious hepatitis, autoimmune conditions, inflammatory bowel diseases, food allergy, food intolerance, and in fact the entire spectrum of the infections and the illnesses in the gastroenterology and hepatology segment. Yeah. So, a word or two about food intolerance and food allergy. I know it is lunchtime, approaching really lunchtime, but we should be aware what is the difference between food allergy and food intolerance. So, food allergy as such is immediate reaction, whereas food intolerance is a response. Now, food allergy, as the word says, is an allergy to the foreign or a food material, whereas food intolerance is generally a delayed response. Whereas food allergy can be life-threatening, it can be life-threatening, it may be life-threatening, whereas food intolerance, it is generally, it is mild and has got symptoms which are less severe. And the symptoms can be taken care if we, have some short interval for the assigned food. So there are various tests to diagnose food allergy and intolerance, so we should be aware of them. So just a quick word about what are the recent updates in about the small bowel markers, especially in the chronic diseases. So American Gastroenterology Association, they published few recommendations. So there was an emphasis about use of biomarkers, how they can be used as a surrogates for endoscopic evaluation and complement symptom based monitoring strategy. So basically the biomarkers which are used are fecal calprotectin, fecal lactoferrin, and C-reactive protein. So basically they help us, these biomarkers, they are especially useful in conditions like ulcerative colitis, where we can adjust the duration and the therapy according to this. So basically the approach is more towards non-invasive rather than invasive. Other guidelines which are updated are about celiac disease. Basically, it is difficult. Basically, the diagnosis of celiac disease in adults, it relies heavily on the duodenal biopsies. Now, the recent recommendations by the American College of Gastroenterology, is that of a non-biopsy approach that can be used in selected situations. For example, in patients who are unwilling or who don't want to go for the biopsies, various markers can be utilized. For example, so what is found is in patients who have high level of tissue transglutaminase immunoglobulin A, like which are tenfold, a second a sample which shows that there are elevated levels of endobasal antibody, then such patients can be diagnosed likely celiac disease patients. So thank you. With this, I would like to call upon for the next category of awards. So would like to have kind attention of everyone. So we are starting with the next category of awards, which is the vibrant ones. So I'd like to call upon stage both our dignitaries, Dr. Prasanna Shah sir, Dr. Anurag Shimal sir, Dr. Anuradha Murthy madam, Dr. Rajeshri Kalkar madam, Dr. Sarala Shroff madam, Dr. Vishal Wadhwa, Dr. Sarala Shah madam, Dr. Sarala Shroff madam, Dr. Shroff madam, please. Okay, so we would like to announce. So the first vibrant one award goes to Dr. Abdullah Mohammad Siddiqui from State GS Medical College. Next award goes to Mr. Amed Andekar from State GS Medical College. Vibrant one. So this award is given for extracurricular activities in addition to the curricular activities that we are doing. Next is Dr. Ankit Yograj Patil from State GS Medical College. छोटानी जय संजय भाई गवर्नमेंट मेडिकल कॉलेज सूरत. डॉक्टर गायत्री देवी मधु राजीव गांधी मेडिकल कॉलेज एंड CSMH हॉस्पिटल करवा. डॉक्टर गायत्री देवी मधु वाइब्रेंट वन. Dr. Gayatri Partani from Grant Medical College, Sir JJ Group of Hospitals. Dr. Gayatri Partani. Next is Dr. Hiran Kumar Gelani from Government Medical College, Surat. So this vibrant one, we acknowledge the all-round development and extracurricular activities that are taken. Muktasid from Rajiv Gandhi Medical College and CSMH Hospital, Karwa. Dr. Muktasid. Please wait. Please wait. Pranav Pandya from Srimati Kashibai Navale Medical College and Hospital, Pune. Pranav Pandya. Ruhi Rajita from SMBT Institute of Medical Sciences and Research Center, Nashik. Ruhi Rajita. Rabadia Gulab Bhai from Government Medical College, Surat. Rabadia Gulab Bhai. Thank you so much. We would like to have one of the the award winners and उनके family members भी जो है जहाँ पे मौजूद है जो आना चाहे और कुछ कुछ कहना चाहे प्लीज.
Good afternoon, everyone. I'm Ruhi Rajita from SMBT Nasik. So I think doctors and medical students have this stereotype that if you speak to a person from the outside the medical field, when they hear the term doctor or medical student, they have this image that this person will be studying 24/7. They don't have time to pursue any hobbies. So I want to thank Metropolis MEDENGAGE for including this category of the vibrant one, which encourages us to excel in fields beyond academics and help us pursue our hobbies while excelling in academics as well. Thank you.
Any of the parents, जो कोई भी पेरेंट्स यहाँ पे मौजूद है, जो कुछ कहना चाहते हो? Yeah.
Good afternoon, everyone. My name is Dr. Pranav Pandya, and I'm a third-year chest and TB medicine resident from Kashi Venavle Hospital, Pune. We all believe that we need a few things to keep us motivated throughout our journey as a resident and a PG student. And we all know that we have been good at some co-curricular activities in the past, and since I'm a recipient of this award, we often feel that we need a few encouragement in between to keep us motivated throughout our journey. So thank you for this. Thank you for this opportunity. I would like to thank Metropolis for including the hypersensitivity pneumonitis panel that is very useful to us for diagnosing hypersensitivity pneumonia, as well as the association that they have with Haystacks Analytics for the whole genome sequencing for non-tubercular mycobacterium. So I'm grateful for that, and thank you for this opportunity.
Thank you so much. 24th was World TB Day. I would like to call Dr. Yashodhara Sonavne here on the stage. So Madam is District Tuberculosis Officer, Kurla L Ward, and I would request her to give away 4 more awards in the same category. Shahad Dhwani Sandeep Kumar for the category Vibrant One. Chotani Jay. Ayush Raman Bhai Patel, the Vibrant One. Gayatri Devi Madhu. Yes. So, Gilani Hiren Kumar. Muktasid Imtiaz Paule. Vidit Joshi. Rabadia Gulab Bhai. Yeah, thank you so much. I would like the award winners to have one quick photograph with the luminaries on the stage. I would like to call upon Dr. Sanjay Gohil on the stage for the next session. Dr. Sanjay Gohil is our AVP, Hematology and HLA Transplant Immunology.
So, good afternoon, everyone. All the respected dignitaries and all the respected audience present over here for this medical summit. So it gives me a sense of pride and to be part of this association and part of this event where education, encouragement, and empowerment, that is a basic foundation of this MEDENGAGE summit. So with this, I would like to invite Dr. Rushi Deshpande sir. So to give a talk on recent advances in on nephrology and transplant immunology. So Dr. Rushi Deshpande does not require any introduction. The sir is basically a director of critical care nephrology at Jaslok Hospital and HN Reliance Hospital. So over to you, sir.
Good afternoon, everybody. Thanks to Metropolis for the kind invite and Dr. Kirti for inviting me here. It's an honor and a privilege to be amongst all of you today, and it's always nice to see young doctors, looking forward to the profession, because you just look at yourself 25 years back and you see one of us in you, that's what I mean. So the talk today that I was asked to give is a bit of update in nephrology, you can say, for the non-practicing nephrologist. Okay, so basically recent trends and innovations in nephrology and kidney transplantation. So this is common knowledge, I believe, that chronic kidney disease is very prevalent, and India, being the diabetes capital of the world, also unfortunately will become a CKD capital of the world. And almost 17% population above 50 years of age has some degree of CKD. Well, what we are talking today is CKD stage 5D, which is basically a stage where you need some sort of renal replacement therapy. So what I tell the patient is, of all the vital organs, you know what is vital? Vital means necessary for life. Of all the vital organs in the human body, the only one that we as medical fraternity have been able to replace is the kidney function. Whether we speak of the excretory function or the synthetic function, this is the only one that you can actually replace. So when it comes to the point of requiring dialysis, that is, you know that your kidneys are not enough for your day-to-day life and you need supplementation. So either you can have dialysis or you can have transplantation. So for the uninitiated, what is dialysis? It is a process which basically purifies your blood of the impurities, maintains homeostasis. Now that is a term familiar to all of us in the audience, and the acid-base electrolyte balance of the body. Whether you do it with the help of a machine like a hemodialysis, where you use an artificial dialyzer, or a peritoneal dialysis, where your own peritoneal membrane does it for you, the result is the same. The result is remove the extra fluid, maintain the homeostasis of the body. Now, it's always, difficult to tell a patient to go on to dialysis in our society. There is this whole phobia of dialysis. But what I try to tell them is, it gives you additional years of life after your life was over, technically, correct? So this actually gives you years to life. And if you are enjoying it, please go for it. I mean, what is better than dialysis for a patient with renal failure is kidney transplantation. Why? Because A, it gives you a longer term survival as compared to dialysis, and also a better quality of life. Now, if you see over the years, the survival advantage and the quality of life advantage in transplant is only getting better with time. And it is definitely the treatment of choice, both in terms of financial as well as quality of life outcomes. So this is what happens. You add a kidney there. The native kidneys are left alone. You normally don't need to remove it. The only time you would remove it is if there was an infection there or a cancerous growth. Otherwise, you would normally leave them alone and just put a new kidney there. Now, is it a new thing to transplant an organ? Actually, no. If you look at the first successful transplant that was done, it was way back in 1954. So maybe next year you will be having like the 70th year of kidney transplant. So it's not a new science. And over the years, the improvement in survival as well as outcomes has definitely made it the treatment of choice. So if you look at Indian transplant scenario, I mean, till last year I was serving as a chairperson for ZTCC, which is the Zonal Transplant Coordination Committee, which distributes kidneys from brain dead donors to the population. And I can tell you that our outcomes with deceased donor is good, but our donation rates are not as good as they should be. So most of our program is actually a living donor kidney transplant program. And almost 80%, 85% of my transplants would be from the living donor pool. Very small from the. And why is it that we are saying better survivals? It is because of thanks to the development of transplant immunology, of which Metropolis, where we are conducting this program today, is an important partner. So transplant immunology has come a long way, and it is helping us improve the outcomes. And even today, we are successfully able to transplant people across blood groups routinely. Like last year, I must have done around 70, 75 odd transplants. And I can tell you that 1/3 of them were across the blood group. And today, we don't even need to know which one was across the blood group because they are all having a similarly good outcome. So, how is it that we are able to do all this? It is because of the improvement in the different tests that we do to look at outcomes. So, how does your body defend itself? I mean, the words innate immunity and acquired immunity are very familiar to the audience, right? So, we need to find a way to trick your body into accepting this organ from another person as your own. And when would it be possible? Is if you are not forming antibodies against that organ and allowing it to live. So there are different tests we do that are shown there: HLA typing, cross matching. The newer ones include donor specific antibodies, flow cytometry. It's evolving as we speak, and better tests are coming up which help us tailor immunosuppression. And based on the patient, you can actually give an individualized immunosuppression prescription, what suits a particular patient. If you look at long term, the concept of tolerance, which means that accepting the kidney without too much of medicine or no medicine ideally, it's going to be a long time before it actually becomes real. But yes, that is something which we look forward to. The surgical techniques have evolved with the help of laparoscopy and now robotic surgery, which helps in making the surgical experience better for the patient. So where is the future going with all this? It is not that everybody who needs dialysis gets an organ. I would think hardly 10% of those who are on dialysis will ever get a kidney. So we need to understand that improvements in dialysis are necessary because the shortfall of organs may never be really achieved. So there is a lot to expect here. And what you look at novel strategies, when you look at what's upcoming, suppose by the time you guys become practicing nephrologists, what will you see? You might see the diagnostics improving further, whereby instead of doing a kidney biopsy to find out what is wrong with the kidney, maybe the blood, some proteomics, metabolomics, or cell-free DNA tests, things like this would become routine, and you will be able to diagnose without actually taking samples from deceased kidneys. Wearable artificial kidney is something new. We are all looking forward to it. So this is in phase 3 now in Europe, and the results are coming out very good. So this might actually become a reality in the next 5 to 10 years, where patients will be having wearable artificial kidneys, and this definitely looks possible today. Xenotransplant, you must be reading in newspapers about organs from animals being transplanted to humans. It's going to take time, but again, the recent experience from brain dead recipients receiving xenotransplants is quite heartening. So yes, that is important. Stem cell based therapies, I think there is time to go there. And what's other thing is the newer medications, which we are going to see more in practice, and they will help us improve our outcomes further. So like we said, novel diagnostic is important because as a practicing nephrologist, what I hate the most today is a patient coming to me late in the duration of his illness, because by then I have missed the chance to cure him. If he comes to me with small shrunken kidneys, what am I going to do? I'm just going to suggest dialysis or transplant. I cannot speak about a cure. So early diagnosis, and that's why diagnostics is so important. You need to diagnose the illness early for the doctor to be able to make a difference in today's day and time. So whether it is imaging or it is lab tests, they are necessary to diagnose the disease early. So this is a busy slide, but just to show you that a lot is on the anvil. And why am I showing these kind of busy slides is just to make you guys understand that there's a lot happening in nephrology that we can all look forward to. So functional nephron number as a concept, we are born with a fixed number of nephrons. So how that will affect the outcomes, novel techniques, whether it is MRI or just, newer contrast-based CTs, lots of things. And finally, I hope someday we have an antifibrotic agent which kind of stops the progression of CKD, because as of today, we can just slow it down. We can't really stop it. Biomarkers, I referred to some of them in the earlier part, but this is important in today's day and time from monitoring a kidney transplant. So if you are able to find DNA from the donor in the patient's blood, it's a bad sign. That is what is the concept of cell-free DNA. If you are able to find something from the donor, then that means you are not reacting positively to it. That means that you may be having a rejection, and these tests will pick up a rejection much before the creatinine goes up. And that is important because, like I said, everything in nephrology is about early diagnosis. If you diagnose early, you can make a difference. Therapeutic alternatives, we spoke about some of them, and like I said, the variable artificial kidney looks possible. Stem cell, I don't know where it is headed, because I think science and commerce have to find a holy grail there for it to become a routine in practice. So it's going to take time. Bioartificial kidneys, xenotransplant, they look more attractive to me as of today. So take home message from this small talk that we had is important to understand and tell the patient that renal replacement therapy, including dialysis, this is the only vital organ which can be supplemented by today's medicine. And you are actually, I can tell the patient with confidence, you come to me with no kidneys and I'll keep you alive for 15-20 years. Tell me one other organ where you can do that without a transplant. You can't, right? Portable dialysis, wearable artificial kidneys will improve the longevity and quality of life. This transplantation, where we are making huge progress, particularly thanks to transplant immunology, this is where, a patient comes to me for a transplant, I can look forward to 20 years of good life as of today, and I hope it only increases with time. So the better diagnostic techniques and improvements in radiodiagnosis will further help us improve the transplant outcomes. The future, yes, looks promising with the wearable artificial kidneys and the immune tolerance and xenotransplants, but it's some time. Hopefully by the time you guys become practicing nephrologists, you should be able to see some of it. Thank you so much for your kind attention.
So thank you so much, Dr. Ruchi Deshpande, for sharing your expertise and insight with all the audience regarding the nephrology and transplant immunology. Only an expert in the field of nephrology and transplant immunology can summarize the entire nephrology and immunology in 10 minutes, like Dr. Ruchi Deshpande has done. Thank you so much. So I would like to invite Dr. Murthy Madam to felicitate Dr. Ruchi Deshpande over here. Thank you, sir. Okay. So now we will go with the next category of award, that is a biscuit. So I would like to invite all the biscuit winners to come near the stage, To giving this set of awards, I would like to invite Dr. Ruchi Deshpande on stage, Dr. Rajiv Joshi, Dr. Nilesh Shah, Dr. Murthy ma'am, Dr. Anurag Shrimal, Dr. Zubair Qazi, Mrs. Shubha Lakshmi Patwardhan, Mr. Rakesh Agrawal, sir. So we'll start with this award. So the first winner for this category is Aditya Pingle from Rajiv Gandhi Medical College. Diya Kasargod from SMBT Institute of Medical Science and Research, Nashik. Dr. Gayatri Sisodia, Padma Shri, Dr. Vittal Rao Vikhe Patil Medical College, Ahmednagar. Dr. Malhar Khadse from GS Medical College, Parel. Pareen Gajar from Government Medical College, Surat. Dr. Neha Sambhaji Jadhav, SMBT Medical College. Dr. Ritvik Jain from St. GS Medical College, Parel. Dr. Sakshi Govilkar from Dr. Vasantrao Pawar Medical College, Nashik. Dr. Shreyan Singh from St. GS Medical College. Dr. Somya Bansal, again from St. GS Medical College. Dr. Vaibhav Maheshwari from RVRS Government Medical College, Bilwara. Dr. Vinit Upadhyay, Terna Medical College, Nerul. Dr. Abdullah Siddiqui, St. GS Medical College, Parel. I'll request one of the award winner to give some experience, share their ideas on the desk. Any of the winner can share their experience over here.
Good afternoon to one and all present here. I just want to take a moment to thank Metropolis MEDENGAGE for coming up with this scholarship. One thing I really liked about it is that you can apply even multiple years. So this is my second year that I'm winning Metropolis. So thank you so much for giving us this opportunity, and we're really grateful to you because you're recognizing medical students and doctors. Thank you so much.
Anybody else? So we can have the one group photo with all the winners over here. One second. I would like to call Dr. Vaibhav Maheshwari from RVRS Government Medical College, Bhilwara, to come on the stage and take the award. And one more doctor is there, Dr. Malhar Khadse from St. GH Medical College, Parel. No, not. Dr. Sri Vidya. Thank you everyone and congratulations to all the winners. So now I would like to invite my colleague Dr. Bhavya Jain, who is a consultant pathologist in Metropolis Reference Lab, Mumbai. So she will be taking over the next session for the gastroenterology.
Good afternoon, everyone. Hope you all are having a beautiful afternoon. And congratulations to all the winners for this MEDENGAGE scholarship. So I am Dr. Bhavya Saxena. I steer neurology in Metropolis. We call it as Neuro Uno. And it's a division which look after all the diagnostics of related to CNS, spinal cord, and all the diseases related to neurology. So I would like to welcome. In fact, I'm honored to invite Dr. Rahul Chapor over stage. He is a very senior neurologist who look after, and he heads neurology in Nair, and he look after a lot of departments and neurology departments in Bombay. So I would like to welcome Sir on stage for his talk on recent advances in neurology.
Good morning, good afternoon, everyone. Thank you, Metropolis and Dr. Kiti, for inviting me to speak at this occasion of the MEDENGAGE Scholarship Awards. It's really a great thing that Metropolis is acknowledging the fresh talent in health sciences. Because what we have today as the young doctors are actually the future of health industry, not just in the country, but for the world. And it is a really great thing to recognize their achievements and encourage them in pursuing their dreams. My talk today is on recent innovations and advances in neurology. As we know, India is a very big country, and if you, what is the problem at hand for neurologists, not just in India, but over the entire world? If you look at the WHO numbers, which recommends one neurologist has to cater for 1 lakh population. Our country has a population of 1.4 billion, and there are only around 3,500 neurologists. So that the ratio becomes like one neurologist per 5 lakh population. And there is a huge gap of neurologists all over the country. The government is trying to bridge this gap by increasing the number of seats to 500 seats per year. But even then, the gap seems to be difficult to be filled in the next few years. So there is a huge scope for neurologists, neurology training, and a lot of things are happening in the field of neurology. So I'll just try to cover as much as possible in the next 10-15 minutes, which itself is a quite an arduous task, looking at the era in which we are living, wherein there are a lot of advances in the field of neurology, not only in diagnostics or therapeutics and or rehabilitation. So what we all know about from neurology history is that from all these stalwarts of neurology, neurology always is being taught in the colleges, medical schools, colleges as something quite mysterious, wherein there are some complicated terms, complicated diagnoses made by listening to the history of the patient and examining the patient. And what essentially the neurologist was represented with is just history taking, examination, and this humble hammer. But in today's, as of today, the diagnostic and therapeutic armamentarium of the neurologist is huge, and the neurologist has several things which give him a correct and accurate diagnosis, and a lot of therapy also is possible in neurological conditions. So we have a variety of now gadgets in our bag with which we can diagnose the patient. So if you look at this with the invent of CT scans and MRIs, and the MRI being available almost all over the country in every smallest of the place, the neurologist is able to diagnose structural lesions, infections, immune-mediated diseases, tumors with great ease. And structural diagnosis is reached within very quickly. And this has obviously helped in giving proper treatment to all the patients. with the advent of PET scanning and other functional imaging, the diseases can be diagnosed at a very early age. And once we diagnose a disease at a very early age, it's quite possible for us to try and halt the progression of disease. It's not just diagnosing rare diseases like PSP, CBS, or multiple system atrophy, corticobasal degeneration, but it's also possible for us to try and halt the progression of diseases like, for example, Parkinson's disease or Alzheimer's disease. Now, coming to molecular pathophysiology of neurological diseases. Now, by reaching a molecular diagnosis, we are able to give targeted therapy to many patients. And this targeted therapy is like monoclonal antibodies. Now, monoclonal antibodies are not just under the purview of the cancer specialists or the rheumatologists or the IID specialists. There are a lot of monoclonal antibodies being used in neurology for diseases like multiple sclerosis, neuromyelitis optica, myelin oligodendrocyte associated diseases. It's not just that the monoclonal antibodies are used in these immune mediated diseases. Monoclonal antibodies have been used in diseases as common as migraine headache, which affects like 20% of the population. Now we have this monoclonal antibody Erinumab, which was FDA approved in 2018 in USA, and it has been approved in India since 2021 March. Being a part of the multicentric international trial, which studied the efficacy and safety of this particular monoclonal antibody Erinumab, I can say with confidence that its effect on migraine is almost magical, and the patient doesn't get headache episodes at all if the patient is on this particular monoclonal antibody. The cost of therapy remains little high, but with the advances in genetic engineering and insurance coverage, I think it will be possible that this particular therapy will be available to many patients of migraine. Coming to genetic advances in neurology, now we are able to diagnose rarest of the rare neurological disorders with the help of this technology, which is called as next generation sequencing. Herein, we actually get a kind of report of the patient's genotype in a very short time with this next generation sequencing technology. We can we can make the diagnosis based on if you order a clinical panel or if you order a clinical exome, or we can also get a whole exome wherein the entire exons of the patient, that is the coding genes of the particular patient, we can get a report on that, like the 21,000 genes which code for proteins. We can get the report in just a matter of few weeks, and it has become quite cheap, and so it's possible for us to reach to a genetic diagnosis for almost most of the neurological conditions which were earlier thought to be quite rare and undiagnosable. So now the percentage of patients who go out of the hospital without a diagnosis in neurology is quite less if you compare it with what was there just 5 or 10 years ago. Now almost 80 to 90% of the patients having neurological problems reach a definitive diagnosis. When we send the sample for genetic testing, first we have to have a good clinical history, good clinical examination, do a detailed clinical phenotyping or endophenotyping, and then accordingly send the genetic test, whether it is clinical panel or clinical exome, whole exome or whole genome or mitochondrial studies. Based on the patient's profile, we send the test, and we're able to reach the diagnosis in many of the rarest of rare neurological conditions. This is a list of conditions which we actually have seen, the patients which we actually have been diagnosed in the last 5 or 10 years. Now, all these rare conditions like ataxia, recessive ataxia, dominant ataxia, dystrophy, myotonia congenita, methylene tetrahydrofolate reductase, mutation deficiency, sign 1 ataxia. There is a big list. The list can go on. All these are real patients, and real patients which have been diagnosed in the last 5 or 10 years based on the next generation sequencing technology. So now this technology has become quite cheap. Initially, these reports we used to get for like 50, 60,000. Now it's as cheap as 15 to 20,000. We get the report of next generation sequencing. And this is really a big breakthrough in diagnosing neurological conditions.
Now, how it makes a real difference to the patient's treatment if we come to a specific diagnosis. I'll just show you in this patient. This patient presented with something like dementia. He had difficulty in finding words. He was not able to name objects. And we thought that it is a degenerative dementia, like something like frontotemporal dementia. But then we sent a genetic test panel, the next generation sequencing panel, and the diagnosis turned out to be CADASIL, or cerebral autosomal dominant arteriopathy with subcortical infarcts and leukoencephalopathy. And just look at the patient, how he has made a recovery. Can we play the video? Volume. Do you have volume?
और पालक क्या है?
पालक एक अलग ही इसमें यूज करते बोलने में यूज करते
Just play the first video.
मेथी क्या होता है?
मेथी एक क्या बोलते हैं मैनिपुलेशन का ये है।
और पालक क्या है?
पालक एक अलग ही इसमें यूज करते बोलने में यूज करते।
शेर क्या है?
शेर एक अलग कैटेगरी में आता है, जिसको हम लोग बोलते हैं कैटेगरी हम शेर के वो उसमें
We couldn't tell what a share is, and now we reached a diagnosis, and after 3 months, just play the second video.
अब मुझे बताइए शेर क्या है?
शेर एक जंगल का राजा है जो आज की तारीख में सबसे हाईएस्ट है।
एप्पल क्या है?
एप्पल एक फल है और वो फ्रूट्स में गिना जाता है।
कुत्ता क्या है?
कुत्ता एक जानवर है जो आज की तारीख में लोगों को
So initially he had problems in naming, and within 3 months after we reached a diagnosis, you can see there is quite improvement in the patient. Now coming to one of the most common neurological degenerative conditions is Alzheimer dementia. The incidence of Alzheimer dementia keeps on increasing with the increasing age, and it is estimated that people who are over 85 years, almost more than 5 to 10% of the people may be having Alzheimer's dementia. So a lot of research has been done in the last few years in terms of knowing the pathophysiology of Alzheimer dementia, early diagnosis and early treatment. So with the advances in imaging, we are able to actually do biomarker testing and test for the underlying pathology of Alzheimer dementia. The underlying pathology for Alzheimer dementia actually starts several decades before the patient presents with memory problems. So there is a huge window of opportunity wherein kind of a prodrome where the pathology is there in the brain, but the patient has not developed the dementia. So this big window of opportunity is there to kind of stop the progression of dementia or try to reverse the progression of dementia. So there are several ways we can do the pathological diagnosis of Alzheimer dementia based on PET scanning, which can label the amyloid plaques, or PET scanning which can label the tau phosphorylation, or by use of the radio tracers, or just simple fluorodeoxyglucose PET scan. We also have CSF biomarkers as well as blood biomarkers, wherein kind of you can do the level of A beta 42 amyloid and take out a ratio of A beta 42 by 40 amyloid and calculate it according to the patient's age and ApoE4 lipoprotein status, and you can kind of predict whether the patient is going to get Alzheimer dementia. And in those patients who are at a high risk, we can enroll those patients into studies which prevent further deposition of amyloid, thus coming to know whether the underlying pathology has progressed or no. There are a lot of studies going on treatment for Alzheimer dementia, but there is not much breakthrough in this. There was recently a monoclonal antibody was approved in US for Alzheimer dementia, and this is the big list of drugs which are currently being studied for patients with Alzheimer dementia. Coming to stroke, stroke is one of the largest killers worldwide. every 6 seconds a patient gets stroke. The major breakthrough in stroke came in 1994, wherein the thrombolysis therapy with TPA was approved by US FDA. This therapy is approved in India and it's available since last 2 decades, and more number of patients are receiving thrombolysis therapy for stroke, and it has clearly been demonstrated that this is a very effective therapy and the patients have a good outcome following thrombolysis therapy, and the disability is quite less. In 2004, another breakthrough was there with the mechanical clot retrieval or mechanical thrombectomy, wherein the Mercy device was approved, and now Mercy, with the help of this Mercy device, mechanical clot retrieval or thrombectomy can be done for patients who present within 6 hours, that is the early window, or also according to the recent trials of Dawn and Diffuse 3 trials, there can be this therapy can be afford to patients up to 24 hours, that is a late window period in selected patients, and the patients have quite good outcomes. But the major revolution kind of in the stroke was with the thrombolysis therapy, which is now easily available in almost all the private hospitals as well as government hospitals. And from my experience of thrombolizing over 500 patients, I can say that this is a real game changer for the patients with stroke. So a lot of things are happening in stroke, as I told you, thrombolysis, mechanical intervention. Also, we can't forget about the rehabilitation. Now, that is a lot of scope in this rehabilitation field, rehabilitation area, and you can see several rehabilitation centers being opened up which offer advanced rehabilitation therapy, which really improve the outcome in stroke patients. Now, India is a huge country, and if you look at one of the most common disorders in neurology is epilepsy. If you look at the numbers of epilepsy, 50 million people in the world have epilepsy. Majority of these patients are from the low and middle income countries. The prevalence of epilepsy is like 6 to 7 per thousand, and the lifetime prevalence is also 6 to 7 per thousand. So you can see such a huge burden of epilepsy is there. Epilepsy also has a problem of social stigma, wrong diagnosis, wrong understanding among healthcare workers, lack of awareness among the people, lack of facilities for proper therapy, wrong diagnosis, and unavailability of drugs. So there is a huge gap in treatment of epilepsy, and even if the therapy of epilepsy is taken over by the general physicians or general doctors, even then this gap seems difficult to be filled. There is a lot of new things which have happened in epilepsy. Initially, up to 1989, there were only 5 or 6 drugs available for treatment of epilepsy. But in the last 2 or 3 decades, around 19 or 20 drugs have been approved, and the therapeutic armamentarium has increased, and there is a big choice for drugs available for epilepsy. This is a big list of drugs which is available for epilepsy, from the first generation drug, second generation drug, and third generation drugs. So there is a big choice, and for selecting the molecule, in particular epilepsy, and also based on, if you reach a correct diagnosis based on the genetics, then the molecules can be targeted, or you can offer some kind of a precision therapy for patients with epilepsy. Another important thing which has happened in the last couple of years or last decade is the epilepsy surgery. So there are many patients who actually can be cured of epilepsy by epilepsy surgery. For this, we need a proper pre-surgical evaluation. The benefits of epilepsy surgery have been demonstrated by class 1 evidence studies, and epilepsy surgery is very effective in patients who have focal epilepsy or partial epilepsy. But the patients have to be carefully selected, and here also there is a huge gap. Almost the majority of the patients who are eligible for epilepsy surgery are not offered epilepsy surgery because of lack of awareness and lack of facilities for pre-surgical evaluation and lack of expertise. So this is another area wherein we need a lot of manpower and expertise, which we expect from the kind of newcomers or the freshers to take up this particular field. Another most important kind of or very happening field in neurology is immune mediated neurology. Now this field basically is a subspecialty of neurology which is overlapping between neurology and immunology. So it is a crosstalk of neurology and immunology. In the last decade, around 30 new antibodies have been discovered, and many diseases which earlier were thought to be idiopathic or infectious have now been proven to be immune mediated disorders with the discovery of several antibodies. So there are different, the diseases can affect either the central nervous system, that is the brain spinal cord, or the peripheral nervous system, the nerve roots, the peripheral nerves, neuromuscular junction, or the muscle. There is a host of encephalitis caused by autoimmune antibodies like LGI1 encephalitis, Casper2 encephalitis, GAD65 associated encephalitis, GABA A, GABA B encephalitis, DPPX encephalitis. And these are not just some rare diseases which you read in books. We have real patients, and thanks to the neuroimmunology section of Metropolis, we were able to diagnose almost all of the diseases which I have mentioned to you just now, based on the immunological reports which we get from the lab, from the Metropolis lab, to be precise. And I'll show you a few cases which we have diagnosed in the last few years. So now this is a patient who came with just twitching in the muscles and some pain in the muscles, or myalgia and twitching. So just play the video. This patient came with twitching. You can see the twitching in the muscles. Next video. You can see the twitching in the muscles. Play the other two videos also. So this particular patient had neuronal hyperexcitability syndrome, and he was diagnosed to have Casper antibodies, and he had almost complete recovery after immunotherapy with immunoglobulins and plasma therapy. Next slide. So this patient had Isaac syndrome, as I told you, neuromyotony or peripheral nerve hyperexcitability because of Casper antibodies. Now, play the video. So this patient came with just stiffness, and the history was that the patient walks like a robot, and he had this type of a robotic kind of a walk, and he was being treated for paraspinal spasm and spondylosis, lumbar and cervical spondylosis. But this particular walk, and if you can look into these two pictures, the board-like abdomen and the tightness in the paraspinal muscles, he was diagnosed with stiff person syndrome, and GAD65 antibody report came positive, and the patient made complete recovery after treatment with immunotherapy. This girl came with history of psychosis and behavioral problems, and she also had these involuntary orofacial movements, and she was being treated outside as some kind of viral encephalitis. Just play the video. This typical involuntary orofacial dyskinesias are diagnostic of NMDA encephalitis, and we sent this NMDA receptor antibody test, which came positive, and the patient was treated with immunotherapy, and the patient made complete recovery. Now this patient came with history of cognitive decline, forgetfulness and memory problems, and not working properly in the office, and he was being treated for dementia, and they thought that it is some kind of Alzheimer dementia or degenerative dementia. But when we saw this patient, just play the video. He had this these oral movements, you can see. Play the another second video. He also had this involuntary hand movements like dystonia. So this is typical of faciobrachial dystonia. The hand and the upper limb moves together periodically. So he had typical faciobrachial dystonia, and we suspected LGI1 encephalitis and sent the antibody test, and it turned out to be positive. And this patient had LGI receptor antibody encephalitis, and he made complete recovery after immunotherapy. So this is this neuroimmunology is quite an happening area in neurology, wherein a lot of treatment can be offered, and we are able to diagnose many conditions. Thank you.
Thank you so much, sir. It was a beautiful presentation. Neurology within itself is a very complex department or an area of diagnostics to diagnose and understand. But by your presentation, I think the people who would not be knowing neurology that much would be understanding what is happening and what we are trying to show it to us. Thank you so much. I would now like to invite Dr. Ali to felicitate Dr. Chakor. Thank you so much, sir. I would like yeah. I would now request Dr. Kirti to invite our chief guest.
Hello, everyone. So we are very honored to have with us Shri Mangal Prabhat Lodha, the Minister for Skill Development, Tourism, Entrepreneurship, and Women and Child Development from the Government of Maharashtra. And I'd like to invite Sir on stage to deliver his address to the crowd.
मेट्रोपोलिस के ऑनर, आप सबके परिवार के मुखिया डॉक्टर सुशील शाह, उनके सभी एसोसिएट डायरेक्टर्स डॉक्टर चकोर, और यहाँ पर आज इस प्रोग्राम में जिस इंटेंशन से ये प्रोग्राम किया हुआ है, उनको हाथ देना जो आगे बढ़कर दूसरों को हाथ दे सकते हैं, ऐसा नए नए मेडिकल स्टूडेंट्स को सपोर्ट देने के लिए CSR एक्टिविटीज़ और उसके साथ में रिसर्च एक्टिविटीज़ भी, इसका गुड मिक्स मेट्रोपोलिस ने किया है। मेट्रोपोलिस के बारे में सबके मन में बहुत प्राउड फीलिंग है। जब कोरोना आया था तो शुरुआत के अंदर तो केवल अंधेरा था, और अंधेरे में जब किसी को हाथ नहीं सूझ रहा था, धुंध छाई हुई थी, उस समय एक ही आशा की किरण थी, वो मेट्रोपोलिस। आपके पास ही लोग आते थे। आपको आज पहली बार शेयर करना चाहता हूँ, मैं भी कई बार आपके अगस्त क्रांति मैदान के पीछे की छोटी सी ब्रांच है, वहाँ पर कई बार मुझे जाना पड़ा था, और मैं सिंसियरली आपको कहना चाहता हूँ कि आपकी जो स्टाफ है, आपके जो एसोसिएट है, हेड्स ऑफ टू देम, कोई कभी नाराज नहीं हुआ, किसी ने टाइमिंग नहीं देखा, और सबने ये समझ लिया कि यदि हमारे ऊपर ये पड़ी होती तो ये आदमी कैसा बिहेव करता था, वैसा आपने लोगों को संभाला। बाद में ठीक है, बहुत सारी और ब्रांचेस खुल गई, बहुत सारे और सेंटर्स ओपन हो गए, पर वो आपका रियल टेस्ट था, और हमारे मन में उसके लिए आपके लिए बहुत प्राउड फीलिंग है, थैंक्स गिविंग है। मेट्रोपोलिस इतने लंबे समय से, 30 साल से ज़्यादा समय से आप काम कर रहे हैं, इतना लंबा बड़ा काम कर रहे हैं, और नॉर्मली लंबा जब आदमी दौड़ता है तो कहीं ना कहीं उसको कोई ठोकर भी लगती है, कोई पत्थर भी मारता है, पर आप पर 30 साल से आज तक केवल फूलों की बरसात हुई है, एप्रिसिएशन का सेंटिमेंट्स आपके साथ लोगों को जुड़ा है। कभी आपके नाम के साथ में, आपके काम के साथ में किसी ने कभी कुछ मन में नहीं आया कि ज़्यादा रेट है, कम रेट है, ये नहीं हुआ, वो नहीं हुआ। नहीं तो बहुत कुछ होता है जब आप पब्लिक डीलिंग्स में जाते हो, यू आर मोर और लेस इन पब्लिक डीलिंग। हम लोग पॉलिटिक्स में है तो कोई न कोई नाराज हम पे होता ही रहता है, पर आपका बेसिक प्रिंसिपल्स आपके बहुत अच्छे हैं, इसलिए आप इतने लंबे समय तक ऐसा सर रख के चल रहे हो। और ये जो CSR एक्टिविटीज़ है, ये कोई CSR एक्टिविटीज़ आपने जब ये कंपनी की शुरुआत की थी तब आपने कोई ये सोच के नहीं की थी कि जैसे आज मैं इतनी बड़ी कंपनी बना पाया हूँ, इतने लोगों को मेरे साथ में जोड़ पाया हूँ, वैसे और भी कुछ लोगों को मैं आज छोटा मोटा सपोर्ट करके ऐसा कभी तैयार हो जाएगा तो मुझे बहुत अच्छा लगेगा कि मेट्रोपोलिस के सामने, मेट्रोपोलिस के सपोर्ट के अंदर, जिस काम के अंदर ये बच्चे काम करना चाहते हैं, उस काम के अंदर जीवन में कई छोटी सी आपकी अंगुली पकड़ने से वो तेज दौड़ना सीख जाएं, तो जितना उनके माँ बाप को खुशी होगी उतनी खुशी डॉक्टर सुशील आपको भी होगी। मेट्रोपोलिस की इस जज्बे को मैं प्रणाम करता हूँ। मैं सभी लोग मुंबई के अंदर जहाँ जहाँ आपकी ब्रांचेज हैं, मेरे को तो ज़्यादा बाहर जाने का काम नहीं पड़ता है, पर मुंबई में तो आपके साथ में लगातार काम पड़ता है। और जिन बच्चों को आज आप ये सपोर्ट कर रहे हैं, हर साल आप 250-300 बच्चों को सपोर्ट करते हैं। ये बच्चों को ये सपोर्ट फाइनेंशियली तो थोड़ा बहुत है ही है, पर उससे ज़्यादा एनकरेजमेंट है। जब कोई गवर्नर हाउस से हमको कोई मेडल मिलता है तो मेडल की वैल्यू कुछ नहीं है, पर गवर्नर हाउस में जाकर हमको मेडल पहनाया गया, इसकी वैल्यू हमको, हमारी ताकत को बहुत बढ़ा देती है। इसी तरह से इन बच्चों को और कहीं से सपोर्ट मिलता तो इतना मज़ा नहीं आता, पर मेट्रोपोलिस हमको सपोर्ट कर रही है, हमको एक्नॉलेज कर रही है, इनके लिए बहुत प्राउड फीलिंग है, रेस्पॉन्सिबिलिटी की भी बात है। आने वाले समय के अंदर आप सारे बच्चे, बड़ी संख्या में यहाँ पर बच्चे आए हुए हैं, वो सारे बच्चे इस बात को ध्यान रखेंगे कि कभी किसी ने आपको बहुत अपनेपन से अपने पास बुलाया था, आपको अपना समझकर आपसे हाथ मिलाया था। जब आपका मौका आएगा तो वापस ये लोन जरूर चुकाना, किसी और का हाथ आम भी थामना। एक छोटी सी बात कई लोगों ने सुनी होगी, ITI में आज से 25-27 साल पहले की घटना है। एक बच्चा ITI में पढ़ने को तो आ गया, एक बार की फीस तो एडमिशन की भर दी, सेकंड फीस में अटक गया। बार बार 2 बार 3 बार उसको मैसेज देने के बाद भी, नोटिस पे नाम लिखाने के बाद भी फीस नहीं भर सका। तो लास्ट में जाके उसने अपने सामान की पैकिंग शुरू की। तब किसी को पता पड़ा, उसके दोस्त को, कि ये बच्चा इस तरह से जा रहा है। उनके दोस्तों ने इकट्ठा करके कॉलेज के मैनेजमेंट से बात की और सब ने उस समय इकट्ठा करके, उस समय की उसकी फ़ीस जो थी कुछ 12,000 या 15,000 थी, वो उस टर्म की फ़ीस भर दी। बच्चे ने सबको बहुत आंखें नमी करके धन्यवाद दिया। समय बीत गया। अभी कुछ साल पहले इसी तरह का एक फंड जो बना था कि जिसको ज़रूरतमंदों बच्चे, उसको कुछ न कुछ मदद की जाए, उसमें इंडियन मनी में कन्वर्ट करके देखें तो 3 करोड़ रुपए अमेरिका से आए, और वो भेजने वाला कोई नहीं, वो बच्चा था जो उस समय 12,000 रुपया नहीं भर सका था। वो अमेरिका चला गया, बड़ा बन गया। तब उसको लगा कि जैसा मेरे उस समय किसी ने 12,000 नहीं भरे होते तो मैं शायद वापस गांव चला गया होता। ये भारत की संस्कृति है, ये भारत की ताकत है, और भारत इसीलिए आगे बढ़ेगा। और मेट्रोपोलिस के सभी, डॉक्टर सुशील के साथ के सभी लोगों को मैं इस बात के लिए पुनः एक बार अभिनंदन करना चाहता हूँ, धन्यवाद देना चाहता हूँ कि आपने न केवल सारा समय बहुत अच्छे तरीके से मेडिकल प्रोफेशन के अंदर, जो लोग कहते हैं कि मेडिकल डॉक्टर के रूप में, मेडिकल प्रोफेशन के रूप में लोग भगवान को देखते हैं, हम सब कभी न कभी जब हॉस्पिटल जाते हैं तब हॉस्पिटल में भर्ती होने का मौका मिले या हमारा कोई रिलेटिव भर्ती हो तो भगवान के बाद में किसी को याद करते हैं, उस डॉक्टर को याद करते हैं या हॉस्पिटल के मैनेजमेंट को याद करते हैं। इतनी ताकत आपके अंदर, इतनी पायसनेस आपके अंदर होती है, और वो पायसनेस पूरी ईमानदारी से लंबे समय तक मेट्रोपोलिस ग्रुप ने निभाई है। मैं महाराष्ट्र सरकार की तरफ से मंत्री होने के नाते उनका अभिनंदन करना चाहता हूँ। मैं जब यहाँ बोलने के लिए आया था तो मेरे हाथ में एक पेपर था जो मैं कुछ नोट बना के लाया था, पर रास्ते में ट्रैफिक ब्लॉक हो गया, किसी की गाड़ी लॉक हो गई, तो मेरे को उतर के आना पड़ा और मेरा पेपर वहीं रह गया। इसलिए जो बोला है मन से बोला है, स्वीकार करें। बहुत बहुत धन्यवाद।
तो हमें ट्रैफिक का धन्यवाद करना पड़ेगा क्योंकि आपने बहुत अच्छा बोला, जो दिल से बोला। एक बहुत राउंड ऑफ अप्लॉज सर के लिए। I will request Chairman Sir and our Chief Financial Officer, Mr. Rakesh Agarwal, to please come and felicitate our chief guest. Shalini, can I have the next set of awards list? So अब हमारे साथ सर हैं तो आई एम श्योर द नेक्स्ट सेट ऑफ स्टूडेंट्स वुड बी एक्साइटेड कि उनको इनसे अवार्ड्स मिल रहे हैं. सो आई वुड लाइक टू इनवाइट द नेक्स्ट सेट ऑफ स्टूडेंट्स. उसके पहले मैं कुछ और गेस्ट को इनवाइट करना चाहूँगी जो सर के साथ ये अवार्ड्स दे सकते हैं. कैन वी हैव डॉक्टर नंदिता ऑन स्टेज प्लीज एंड डॉक्टर चकोर सर प्लीज जॉइन अस. Dr. Safala from the Metropolis Foundation and Dr. Sonavne from the City TB unit, please come on stage. Can we have the winners? Ajay Yadav, BJ Medical College, Pune. आकाश मंत्री जीएस मेडिकल कॉलेज परेल मुंबई. आमे अंबिके जीएस मेडिकल कॉलेज मुंबई. आस्था गुप्ता सुखनगर मेडिकल कॉलेज जबलपुर. जैसे कि मैंने पहले कहा था आप अपने पेरेंट्स को साथ में लेके आइए. जो भी पेरेंट्स आए हैं, जो भी फ्रेंड्स, बॉयफ्रेंड्स, वाइफ, हस्बैंड, जो भी है साथ में आओ. शेयर द मोमेंट. अंकित कुमार जीएस मेडिकल कॉलेज परेल. अंकित seems to be very popular. चिन्मय हरिदास श्री वसंतराव नायक गवर्नमेंट मेडिकल कॉलेज हॉस्पिटल यवतमल. फ्लिंटा रॉड्रिक्स जीएस मेडिकल कॉलेज परेल मुंबई. कुसुमिता छाबड़ा रामचंद्र मेडिकल कॉलेज. मेघना बदामी माइसोर मेडिकल कॉलेज एंड रिसर्च इंस्टीट्यूट. As you all can notice, more than 516 cities applications were received, so you can see representation from all across the country. Neha Khadse and Neha Damodar. GS Medical College, Parel, Mumbai. Paras Wagmare, Government Medical College, Nagpur. Pipalia Meet Vijay Bagai, Government Medical College, Surat. Prabhat Mittal, Saptagiri Institute of Medical Sciences, Bangalore. Samapti Devnath, Shillong. Samapti's come from Shillong. Give her a cheer. Sanket Patil, GS Medical College. Shirmeen More, GS Medical College, Parel. So big round of applause for our scholar callers. These are the doctors of tomorrow, the specialists of tomorrow. I would like 2-3 of them to say something. Yes, of course, please.
I'm the mother of Asta Gupta, and I'm very proud to be out here. In fact, she's my single girl child, and Beti Bachao, Beti Padhao. I've be a strong advocate of that. And like I'm a biotechnologist, I couldn't be a doctor, a practicing clinician, but my daughter, she's keeping my ambition, and I hope with all your blessings and God's blessing, she'll do something good for the society. Thanks a lot.
Sushil sir, please join us on stage. Sir, Bolman. Yes, of course.
Respected chairperson, sir, and all the dignitaries present here. Myself, Samapti Devnath. I'm a final year MBBS student of Nigrim Shillong. I really feel privileged to stand here, and the hospitality I received from entering the door till here now, it's really commendable. Thank you so much, Metropolis India, for this. And not to forget, to thank my support system, my mummy, papa, my elder sister, and my best friend Asmita. Thank you. Thanks, Doctor.
Can I invite our CFO Rakesh to add something for this young talent from Shillong?
So I happens to be her neighbor actually. So I was telling her that I go to Shillong every weekend when I was kid, and it's very near to us, and I have a lot of people who are in Shillong. So I'm proud of to see somebody from Shillong coming out here and receiving this award. We say that Northeast doesn't produce good talent, so two of us are here. Thank you.
It's an honor. What doesn't produce talent? Thank you so much. We'll move on to the next segment. Can I invite Dr. Smita? She's our head of lab, Pune. Over to you, Dr. Smita.
Good afternoon, all, and welcome again. First of all, I would like to congratulate all the winners over here, and I would like to take the opportunity to call Dr. Nandita over here for the talk. So, Dr. Nandita, she's a director for Bloom IVF, and she's having a huge experience of 28 years, and she's also she have gained many of the awards, renowned awards, and I would like to have that privilege to be here, means to call her over here for the speech.
Good afternoon, everybody. How's the Josh? You must be feeling very, very good. I think it's fantastic. Dr. Sushil Shah, Metropolis, Dr. Dhuru Shah, I think congratulations. It's fantastic, the work that you're doing, fabulous work that you're doing, and it really feels good to see the good energy. And Shri Mangal Prasad Lodhaji, thank you very much. I think you've spoken so highly about Metropolis. And from your heart, those words came. And actually, it makes us doctors feel very good because, we are always giving everybody. And I think that is the ethos that these young people need to know. And friends, today, what I'm really going to talk about, actually, Durusha has been an inspiration to me. When we were students, we used to always watch her, beautiful, elegant, and so good at her work, and we always wanted to be like her. And Dr. Sushil Shah both of them were from my college, GMC, Grand Medical College. And they were a couple which we always emulated. And today I'm so happy to be here. Thank you for inviting me here. Dr. Kirti, Dr. Smita, thank you for that. And Safala, good to see you. So friends, I think this is a fantastic step in your life. I think the encouragement which you're getting with this scholarship is fabulous. And today what I'm going to talk about is, what are the different mantras in our lives? I think as doctors, we have a very different view towards what life should be, where it takes us, and exactly. And I think one thing that all of y'all must have is self-belief. And then, of course, I'll talk to you about gynecology. But remember that you've reached here because of your self-belief. Never let that go. However difficult, however hard your path is, I think there are certain mantras of success which takes you right there. And the first one is actually self-belief. The second one is actually planning. You plan where you want to be. You decide where you want to go. And I think that is very important strategy. Planning, strategy, where you want to go. Another important, I think, in a doctor's life is mastery over communication. Today's world, you really need to be able to communicate with your patient. Whether you're in a clinical field, non-clinical field, I think communication is very, very important. And one aspect, we are seeing a lot of problems in our country, doctors, the respect of doctors, the faith over doctors. I think what is important is communication. And that communication has broken through because of what? Digitalization. We are depending more on, people also not that attentive when they sit in your clinic, phones are ringing, things are pinging. So I think it's very important that we master communication. And one important quality, can you tell me which is the most important quality in a doctor? Empathy. Imagine if you are sitting in a clinic and you're treating a patient, you should look at that person, that she is your daughter, she is your sister, or she's your mother. How would you treat her? I think if you follow that, you will be very, very successful in life. You will be a very, very successful doctor. I think these 4 qualities, if you imbibe, it would be really great. Now let me switch over to the field of gynecology. I think I've been a gynecologist for 30 years plus. I started in 1986, my training in gynecology. And it's been a wonderful, wonderful journey. Gynecology has really progressed. It's a fascinating field right now. And then in 1993, I went into in vitro fertilization, IVF. At that point, actually, there was a lot of conflict in my mind. There were 3 things that were really driving me, whether to just continue doing OB-GYN, deliver patients, do routine, or go for super specialization. Then there were these fabulous surgeons around me. So it was like, they were operating, doing fabulous surgery, and here was the lure of technology which was there. IVF was like a spacecraft, fantastic. You're creating life outside the body. It was like fabulous. I was like, to do this or to do that. The other thing that was really hot in those days was family planning. There was a lot of importance being given to family planning, contraception, etc. And I was wondering whether to go into family planning or infertility. Infertility was way like nobody even looked at it. Hardly anybody went for infertility. But then I decided, let me take the path which is less trodden. There were very few people who were doing infertility at that point. And I actually went in there, and trust me, I've never looked back. Never, never looked back. Infertility has gone beyond everything. In fact, gynecology as a field is fabulous. There are so many things happening in our field. I think it's really, I've, put down a few things that some of the best technological advances today in the health industry actually are in gynecology. And you may be wondering, what am I talking about technology? I think you kids are very techno savvy, and you have to be techno savvy to be able to work in the field of health. Today, the field of health is infiltrated, governed, whatever you want to say, by technology. And it is very important to understand and how to utilize this technology. Today we are talking about Chat GPT, artificial intelligence. In IVF, we are using artificial intelligence for the past 4 years. You're doing Chat GPT now. Artificial intelligence has entered IVF so many years ago. So today, when a patient comes to me for egg freezing, you don't want to have a child quickly, you have cancer, your fertility gets affected. I have young girls who are going abroad for studies, and they do not want to have a child. So they come to me for egg freezing, for preserving their fertility. Now we have an artificial intelligence system where once the eggs are retrieved, these eggs are subjected to an AI report, which actually tells me this is the chance of live birth rate if those frozen eggs are used later on in life. Can you imagine? It's fabulous, because I have a lot of patients of endometriosis where I've frozen eggs. They've given me very less eggs, 3, 4. So then I'm able to tell her that, no, please do a couple of more eggs I need to give her that baby. I think that is the power of technology when you combine it with health. So artificial intelligence has come in a big way. Then the mRNA technology. I think the mRNA technology has entered all fields, but in gynecology, it has gone beyond. You look at this life of a cell. We didn't know what was happening. The oocyte is the biggest cell in the body. Do you know that? The oocyte is the biggest cell in the body. And there are how many? GATC are the protein codes, right, in the chromosome. How many combinations are there? Any idea? Come on, take a guess. 3 billion. 3 billion combinations are there in that chromosome. And those chromosomes are like, they're beads on a string. And it's all compacted into that nucleus. And how long is that chromosome if you just open it and put it over here? 2 meters. Can you imagine how beautiful the body is? And how did we unravel it? It's all the single sequence DNA, single sequence RNA, all these technologies, which probably Sushil is using in his lab, have actually brought in all this knowledge, all this in-depth knowledge. We can actually look into the cell, what is happening today. It's beautiful. I had a beautiful video of how the DNA and the RNA, DNA carries all your code, but DNA does not carry out the function. So if it wants to carry out the function, it actually copies onto the RNA. So what happens is a small part of DNA, say your body wants to carry out a function, it wants to produce a protein. It will give an instruction and the RNA is actually copied from the DNA. And it's a machine which is happening in your billions of cells. They're functioning all the time. Even as you sit here, they're functioning. So that technology has changed healthcare and it's even entered into our field. Today, we can analyze problems with the child. We do pre-implantation genetic diagnosis. So when we have the embryo in the lab, that embryo can be biopsied. It is tested for genetic diseases and it can be put back. Do you know there's a new technology called PGTP in America? It's not yet available in India. What does it do? It'll tell you how intelligent your child can be. Can you imagine? Polygenic score, but it's not ethically permitted. But there is the technology available because of all this that you can actually identify this embryo. So biotechnology, combining it with health is phenomenal. And I think, I wish I was as young as you, because I think, there's so much to do. There's so many, the world is so wide and there are so many things, so many different aspects that you can get into. So I think you are at that point in life where it's beautiful. Health, I should not say industry, but yeah, health industry is really amazing. It's burgeoning. Coming back to gynecology, virtual reality is another thing which helps us in our surgeries. Robotics are in, and especially, if you know about fibroids and all, they help us in diagnosing fibroids, which are right inside the muscle. And we have a virtual reality program which actually shows you, and virtual reality can be helped in education. I think it's a fantastic tool for education. Then precision medicine. I'm using precision medicine today. A lot of people are telling me, oh, forget it, it's not useful, it is not evidence-based. But I think I'm one of those people who do try a lot of things. Sometimes they work, sometimes they don't. I bought a machine 10 years ago, Metabolomics. It was a complete dud, total investment failure, because the company withdrew that machine. They said the time is not yet, but today it's prime time for metabolomics. It's back into the labs and it's being used, and we'll probably go for it next. But precision medicine is here to stay. It is there in oncology, it is there in other fields, and it is coming in reproductive medicine. And it gives you so much of information. I'm telling you, 5 years down the line, when a patient walks into the clinic, first test that will be done is I will be sending him to Metropolis, and his whole genomic profile will be given to me by Metropolis, saying that these are the problems. Yes, that to give her these drugs, these will work on her, this will not work on her. That is what is precision medicine coming to. And I think that's fantastic, and we need to be updated with what that is happening. And of course, CRISPR. CRISPR is the new kid on the block. I'm very excited about that. You know what that is? All of you know about movie editing. What do? Acha nahi laga to kaat do, wapas, kar do. So you have gene editing. Can you believe it? You have a defective gene. Right now, what I'm doing, I throw that embryo out. If it's a Down's baby, that embryo has Down's baby, I throw it out. I discard that embryo. But no, with this technology of CRISPR, Doudna and Charpentier are two women who won the Nobel Prize in 2019 for CRISPR. In fact, I'm reading Doudna's autobiography right now, Code Breaker it's called. Fabulous autobiography. And the way she struggled and how she grew up in this Caribbean island and how she was treated differently. And, that difference made her want to do something. So sometimes your negativity can actually push you into excellence. So I think this is what we need to understand from life. So CRISPR, coming back to CRISPR, 2 women won the Nobel Prize. You can actually edit the gene. It's like a DNA scissor, it's known as. You go in with a scissor, you cut that faulty DNA, you remove it, and you put it back in. It's a virus, actually. So you put in this virus, and it goes in and removes that faulty DNA and comes back. So that is what is CRISPR, and it's already being, there was a workshop in India. India is so fast, so progressive in it. There are workshops genetically modified crops. They're trying to have mosquitoes which are malaria free, dengue free. So CRISPR is being used to create that. Then, of course, the next new thing that we are working on is health wearables. You have your Apple Watch, right? Right now, what is it? Heart attack, aega, fibrillation, heart monitor, BP. What we really want to do is tell the girl, go. You want to have a baby? This is the right time. You don't want to have a baby? Don't do it. Or have protected sex. I think that's something different and something that's happening, and health wearables are going to come in, and they are. In fact, do you know something? You can do a semen analysis with your phone. You can produce a sample, and I think you should have that app, which you should let it out. You're the one who's giving it. So you actually can do it at home. On the app, you can figure out your semen analysis at home. And of course, telemedicine. But I think gynecology, can you imagine gynecology and obstetrics and IVF, and there's fetal medicine and there's endoscopy. There's so much more to everything in health. I think I'm really, really happy that I'm in this field. And my father, Dr. D.Y. Patil, he always told me one thing. One day I came back from work and I was harassed, I was tired, I was fed up. I said, I am so exhausted and I'm tired and I'm fed up. So he looked at me and he said, what did you do today? I said, I was working in the hospital. I saw so many patients. I did so many cases. He asked me, do you enjoy your work? Do you love your work? He asked me. I said, of course I love my work. So he said, remember one thing. If you love your work, if you enjoy your work, if you're passionate about your work, that work should give you more energy and more enthusiasm. It should never make you tired. And that has been my mantra throughout my life. So friends, thank you very much. Thank you very much. And thank you, Dr. Sushil Shah, for this opportunity. Thank you, Kirti. Thank you, Dr. Durusha. I really enjoyed talking to everybody. Thank you.
Thank you for such a fabulous talk, ma'am. And it was like we are really like in the spacecraft and going from here to there. It's a very different journey what we have seen and what you have told now. So I would like to call Dr. Rohini to felicitate Madam. Rohini ma'am, please be here. We will call our next set of students for the scholarship. For this, I would like to call Duru ma'am, please be on the stage, and even Dr. Kirti Chata. Wordsmith. And I would like to call all the students over here with their parents, as Dr. Kitty told earlier. So our first student is Dr. Amlesh Khonikari. He is from Somaya Medical College, Sayan. Next is Apurva Doshi from St. J.S. Medical College, Parel. Apurva Doshi. Next is Avishpa Kar from Manipal Tata Medical College, Jamshedpur.
And also invite us here to come on the dais and felicitate some of the students. Doctors for you.
Next student is Peladia Ashish Praveen Bhai, Government Medical College, Surat. Next is Pratik Agarwal from Lokmanya Tilak Municipal Medical College, Sayan. Our next student is Renuka Ashtekar, Tata Memorial Hospital. If your parents are here, I request all the parents to join with the student over here. Next is Sharvari Mande, Rajashri Chhatrapati Shahu Maharaj Government Medical College, Kolhapur. Next is Shubham Shinde from BJ Medical College, Pune. Sumaya Meman, Government Medical College, Nagpur. Next is Ujjaini Rudra, Rural Medical College, Loni. I would like to request any of the students who want to share their experience.
Hi everyone, my name is Pratik Agarwal. I remember refreshing my Gmail every day after applying for the MEDENGAGE awards ki aaj mila kya. And so there was this one day where a few of my friends started receiving the award and I saw my Gmail and I didn't receive one. So I was very sad. I went to mom and said ki mummy nahi mila. So mom was like koi baat nahi, theek hai. So 2-3 hours later, I did receive an email. But this time I was even sadder than before, and I went to her and I said ki I was with a sad face. So she asked kya hua? So I said mummy mil gaya. So then she was like फिर रो क्यों रहा है? So I was like mummy मेरी दोस्त को मेरे से बड़ा वाला award मिला. So the conclusion being that in this competitive world where everyone competes for everything, if MEDENGAGE can offer something where you compete not only for academics but for being a wholesome clinician with research, with literature and everything, it is really a commendable job. So thank you so much.
Next time you try for the Bada Wala award. Huh? And there is no Bada Chota.
Well, I would like to thank MEDENGAGE for giving this category because as a part of our medical curriculum, we don't really learn much, or we are not incentivized to learn about the current advancements and the future trends in the healthcare industry. And I feel that as a part of this industry as future doctors, it's really important that we read more about them and contribute to it more. So I would like to thank MEDENGAGE for keeping this category, which incentivizes us to become more up to date with what's really going on with the future of healthcare. Thank you.
He said a very important point. So these people who you're sitting, who you're seeing standing on stage right now, they've all won the wordsmith category. And this year the topic for the essay was artificial intelligence in healthcare. So these are the kids who are going to rock the world, right? So big round of applause for them. And when I was backstage, one of the parents told me that, we have never seen a young doctor getting awarded. Generally, doctors get awarded when they have gray hair. So it's very nice to see multicolored hair getting awarded, right? Because today everybody has different color hair. So big round of applause for the wordsmith winners.
Hi, myself Shubham. I did won the Champions of Champions last year and Wordsmith this year, and I'm very thankful to MEDENGAGE and Metropolis. So I would like to thank MEDENGAGE and Metropolis for its noble cause of uplifting the healthcare in general, and also for providing helping hand to med students in their journey to pursue medicine. But I thank them even more for including one specific category, that is Champions of Champions. Because in this era of increasing cases of depression and mental issues, which is highly due to academic failure, one needs to be backed for his extracurricular achievements, right? And talking about what Metropolis is, pathology is always known for writing the statement called as correlated clinically. But with its cutting edge advances by Metropolis, I guess physicians might change it saying correlated pathologically.
Thank you, Shubham. There are two more awards. One is Shaurya Jain and Prashant Saraf. I would like to call them on the stage. Prashant Saraf. Let's have a group photograph. One of the parents want to say something.
Hello, I'm Anuja Mande. It's a very proud feeling for us as a parent, and thank you Metropolis for enhancing the inbuilt talent of the students. Thank you.
I'm also a parent of Sharvari Mande. She got right now the award. I want to talk one thing about that. I'm a professor here at MIT Pune. I'm a computer engineer, but due to a certain problems, I cannot complete my PhD. तो मैं अभी मेरे मैनेजमेंट को बोलता हूँ मैं डॉक्टर नहीं बन सका PhD, मेरी बेटी बन गई डॉक्टर, डॉक्टर का बाप बन गया.
I'd like to invite Dr. Ali to conduct the last set of awards, last but not the least.
So good evening, good afternoon everyone, and this is the last set of awards. So I would like to call upon on stage Dr. Murthy ma'am. Dr. Sushil sir, if you can please honor the stage, and Sanjay, if you can come up, so that we can honor the last category, the pedagogue category. It's been a wonderful afternoon today, where we are honoring emerging medical talent. I would also like to invite Dr. Bhavya to come up on stage, please. So, beginning with Ameya Machave from Seth GS Medical College, Parel. Can you please come up on stage? Ashmita Jain from Seth GS Medical College, Parel. Debayan Banerjee, again from Seth GS Medical College. So I think Dr. Murthy will be really very happy because a lot of students are from KEM, her alma mater. Devesh Dharmarajan, again from Seth GS Medical College, Parel. Gopal Purohit from Rajiv Gandhi Medical College and Chhatrapati Shivaji Maharaj Hospital. Harsh Marathe from Seth GS Medical College. Janvi from SMBT IMSRC. Jayesh Khabia from RVRS Medical College, Bhilwara. Junaid Sheikh from Seth GS Medical College, Parel. Manav Shah from Seth GS Medical College, Parel. Manish Yadav from Terna Medical College and Hospital, Nerul. A very big round of applause to the winners. I request if anyone from this category would like to share their thoughts.
Good afternoon, everyone. I think a lot has already been mentioned, but what I'd like to mention here is, first of all, I'd like to thank MEDENGAGE Metropolis for giving all of us this opportunity. And there's this one thing which hasn't been mentioned yet. So I am from 2019 batch, which means I still have 2 years to become a doctor. And this platform today has just made my grandmother, especially my nanny, so proud of me because they've given me this platform where I could get her proud. Thank you so much for this opportunity.
These are particularly emotional moments for the whole family and the entire medical fraternity being here. It's amazing to see these emotions pour out. So there are some more winners. If I can have the list, please, I can announce them as soon as possible. Don't worry, the names are there in the list. हाँ, इतना ही है ये बोल दिया हाँ थैंक्स Rutvik Bhutekar from Government Medical College, Aurangabad. Sakshi Chavan from St. J.S. Medical College, Parel. Siddharth Agarwal from St. J.S. Medical College, Parel. Swati Iyer from Ashwini Rural Medical College, Solapur. Taha Electric Wala from Lokmanya Tilak Municipal Medical College, Sion. Tanuj Presswala from Government Medical College, Surat. Ukba Rafiq Bhatt from Rajiv Gandhi Medical College and Chhatrapati Shivaji Maharaj Hospital. मेरे ख्याल में अब लिस्ट खत्म हो गई है सो अगर और भी कोई अपने थॉट्स शेयर करना चाहता है तो प्लीज कीजिए वरना आप लोग लंच के बीच में अड़चन डाले हुए आइए
Hello, so I am Tanuj from Surat. I would like to thank Metropolis and MEDENGAGE for this wonderful initiative. It was really great to hear from Sushil sir and Duru ma'am about the journey of Metropolis and the wonderful good work they have done, the work in public health apart from the diagnostic. It is really very motivating to receive such award. This time I achieved award in pedagogue. We'll apply next year also as Kirti ma'am said and we'll try to achieve in Champion of Champions. Thank you.
So we need to all be a little thin and fit over here, stay over here. All the winners on stage, all the winners. Well, you can sit on the steps, stage, anywhere. इसके बाद टूट भी जाए तो कोई गम नहीं बैठो बैठो Come on, all the winners on stage, all the jury, all the faculty, can we please have MEDENGAGE jury members, key opinion leaders, moderators, Metropolis team. No. Come on everyone, come on stage. Can we have the Metropolis Foundation and the top management? Please join on stage. Pradeep sir, Amita ma'am, Rohini ma'am, sub stage pe aao please. Dr. Safala, come. Some people can stand on the ground floor also, नीचे. Steps, sit on the steps. would like to invite our Chief Financial Officer, Mr. Rakesh Agarwal, to deliver the vote of thanks, please, before everybody jumps on the lunch. Hold it for 5 minutes.
Please hold on 2 minutes, huh? Will not take more than 2 minutes. I think everybody. should we do it? But okay. Good afternoon, everybody. We'll take 2 minutes to thank. I think this is very important that whoever has made it possible and contributed to this whole program, I think we should all thank them. So, friends, it's an honor to be part of this wonderful event on behalf of Metropolis. But I would like to express my heartfelt gratitude to all our esteemed guests. Our chief guest, Honorable Sri Mangal Prabhat Lodha, our guest of honor, Sri N. Naveen Sona, for taking the time to attend and grace the event. Thank you very much, sir. I would like to express our gratitude to all our key opinion leaders, including Prasanna Shah, Dr. Prasanna Shah, Dr. Anurag Srimal, and Padam Shri and Padam Bhushan, Dr. Suresh Advani, Dr. Rushi Deshpande, Dr. Rahul Chakor, Dr. Nanita Palsetkar for sharing their expertise and insight with all our attendees. Thank you all of our Metropolis scientific experts, including Dr. Niranjan Patil, Dr. Shekhali Borodawala, Dr. Sanjay Gohil, Dr. Bhavya Saxena, and Dr. Smita Sudke for successfully moderating their respective sessions. My sincere appreciation goes to our beloved chairman, Dr. Sushil Shah, our MD, Mrs. Amira Shah, our CEO, Mr. Surendran, for spearheading this motivational CSR initiative. I want to express my gratitude to Metropolis Foundation Chairman, Dr. Durusha Ma'am, and Managing Trustees, Dr. Safala Shroff and Dr. Prakash Gurnani, for their guidance and assistance in successfully directing the entire program. Dr. Kirti Chadha, I don't think this would have been possible without you. The face of MEDENGAGE Summit deserves a special mention. Her efforts and contribution to this event are greatly appreciated. I think big round of applause for Dr. Kirti. We sincerely thank Salini Sahai, Dr. Vishal Wadhwa, Komal, Dr. Rakhi Bajpai, Rohit Gaikwad, Dr. Sivani Ramchandran, Raj Jatele, and Jai Singh Balakrishnan for their contribution to the success. They are all working behind the scene, but they have really contributed a lot to this whole program. We would like to extend our most sincere thanks to our distinguished jury member for taking time out of their busy schedule to assist us in evaluating applications. We are extremely thankful to ENY for serving as a process partners. Would like to congratulate and thanks all of winners and their families for traveling all the way from different parts of the country to support the summit. We want to thank all of the winners and participants who were able to attend the event virtually. Last, we want to thank the member of the press for covering our CSR event and enabling us to reach a larger audience. We would like to thank our event partners, 24 Frames Digital, our hospitality partner, Jade Luxury Banquets, our PR partner, Intellectco, and all other vendors for this contribution. Once again, kudos to all the winners and thank you everyone who helped make the event a great grand success. Thank you so much. Thank you.
So you're all cordially invited to have lunch now. And 2-3 announcements. There is a photo booth outside. You can click your picture. You can carry the printed copy of that on the sleeve with you as you go out. It will be given to you immediately. There is a pledge wall. Don't forget to make a healthcare pledge. And can I invite the organizing committee over here for a picture, the entire Metropolis team and all the entire organizing committee. Can I have Metropolis team on the stage, please? All the Metropolis team members, please come. All Metropolitans who have made this a big success, please join us. Can I invite all Metropolitans for a group picture? Sir and Madam, please join us.